Let's have the roll call.
Morning, everyone. Roll call for Health, Education, and Human Service Committee, 24th Navajo Nation Council, regular meeting via telecommunications, August 12th, 2020, 10 a.m. Honorable Paul DeGay Jr.
Present.
Honorable Carl Russell Slater.
Doug Slater, present.
Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So.
Present.
Honorable Daniel E. So.
Present.
Honorable Edison J. Winika.
Here.
Okay, Chair, we have 5 members, constitute a quorum.
Great. Ja, deze en Edo, Shates en Bagi this was on het jaiki. Asin so it's bakaya just days into or kike days into kwaje nina nashadan lunegi ajekto na nashadat egi bikadanit ko satoshi ya da is antoli so kwaige shi ya da il inhigi ta on later colleges ko kwaige ya citizen nature sto asani klindo le ko kwaige ya Tele Edison Winika, would you provide us the invocation to start off today's proceedings?
Okay, thank you, Chair, and members of the committee. Before we start our meeting, Heavenly Father, we come before Thee at this time. We're so thankful for all the many blessings that Thou bestowest upon each and every one of us. We're so thankful for one another, for being on the S committee. Father, bless us that we might always respect one another, that we might respect one another in reference to responsibility that we have, and also the closeness that we have as committee members. We're so thankful for the clanship that we use to express our love for one another. And we're so thankful, Father, for the responsibility that we've been given. And we're so thankful for all those that are online with us and those that will present to us, for the staff and members of the Navajo Nation. And we're so thankful for our president, our vice president, our chapter officials, and for all the employees of the Navajo Nation. The leadership in the respective divisions and the different levels of government that we have. We're so thankful, Father, for Thee, for the blessings that Thou bestows upon us. And Father, be with all the people of Navajo Nation and throughout the world, the counties, the state, the federal government, and bless us that we might always be mindful of the responsibility that we have, that we might always provide the guidance that is needed to our people and to our children, to our families, to our loved ones. And Father, I know that we're going through a lot at this time because of the pandemic, but bless us that we might help each other by keeping ourselves safe. By keeping ourselves safe, we help others to be safe also. And we might continue to provide the messages that are needed to help each other to be safe. And Father, be with us in all that we do. We're so thankful, Father, for everything. And be with us now as we conduct our meeting, that we might do so in a pleasing manner before thee. And bless us that we might make decisions that will benefit those that will be coming before us, that we might be able to understand their concerns, and that we might be able to provide the appropriate guidance that they need. And be with us when the time comes that we might return to our responsibility. And if we need to travel, that we might do so in safety. And be with us throughout this day. We humbly pray in thy Son's name, Jesus Christ. Amen.
Amen. Amen.
Hello, Cecilia. Good to hear your voice, each and every one of you, as we did roll call. Cecilia, Paul Slater, Che, Paul Begay, Jabizza, Charlene. So, Edison, Winiko, thank you for that wonderful prayer. It was good to see you yesterday. I was in Window Rock to sign documents and pick up mail and get messages, so it was good to see brother. Taylor, committee members. We get to the point we have review and adopt the committee members. Did you have any announcements that you wanted to highlight before we go to the review and adopting the agenda?
Chair yeah, hey, Benna.
Hey, it's not us.
I made it on. The
Okay.
phone was busy. I don't know why it kept giving me busy signal, and then it finally went through, so I'm on the line. I want to let you know that I'm here, present for the meeting.
We have a full slate. We have all members of the HES committee present, and thank you for being able to do that. If there's no announcements, then Shema, Ms. Beverly Martinez, can you provide the review on the agenda?
Mr. Chair, we have number 2, recognized guests.
Okay. Are there any folks that go through the folks on the line? Introduce yourself.
This is Derek Franklin. Jordan City from DeBogsba. A quick announcement. I'm going to be sending out a little flyer. We're going to be having a BIE update meeting with BIE Navajo region's top officials. So it's going to be scheduled for August 25th. Some of the topics that we have is going to be regarding the CARES Act, BIE reopening plan for Navajo Nation, assessment, human resources, hiring practices, and then also facilities. So I will send it to Ms. Martinez, and I hope that you guys are able to get on during that time. A lot of the questions it's going to be coming from the school board members because BIE hasn't been communicating and being transparent about this whole reopening of schools. So just want to thank you all, and I'll be listening. Good morning, and hope you guys are all safe out there. Thanks.
Good morning. This is Perfilia Fowler, Division of Human Resources on the line. Thank you, Che.
This is Calvin White with Department of Education.
Good morning, Honorable Chairman So and committee members. This is Christy Almaligi with Sage Memorial Hospital on the line.
Good morning, Christy.
Good morning.
Good morning.
Good morning.
This
This
is
is Kristen Lowell at the Office of Legislative Counsel.
Good morning. This is Isabella Robbins, staff writer, Office Speaker.
This is Mary Pembroke with Indian Country Today.
Good morning, Recita Toddy with the Department of Personnel Management.
Good morning, Deanna Neswagishi, Division of Social Services, Executive Director.
Oh, good morning, Deanna.
Good morning, Pernell.
Good morning, Gabriel Yazzie with Kent Township.
Anybody else?
Good morning, Mr. Chair. Rosalind Begay with Division of Social Services.
Oh.
Good morning, this is Dave Nezzi with Senator Heinrich's office.
Hey, Shanella, good to hear your voice.
Mr. Chair,
Good morning, this is Associate Division of Social Services.
Mr. Chair, this is Derek Franklin from Doty. I'm not sure if you guys heard me the first time. Okay.
Oh, yeah, they. Okay, now we go on to review and adopting the agenda. Ms. Martinez?
Good morning, everyone. Agenda of the Health, Education, Human Services Committee, 24th Navajo Nation Council, regular meeting Viva by telecommunications, August 12, 2020, 10 a.m. Presiding Honorable Daniel E. So, Chairperson Honorable Carl Russell Slater, Vice Chairperson, Place Viva Telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation, announcements. 2, recognize guests and visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals, July 15, 2020, July 29, 2020. 5, receive and report. A, update report from Navajo Department of Health regarding CARES Act list. B, update report from Department of Dene Education regarding the opening of schools and wide room school. C, report from Department of Personnel Management on protocols for staff returning to work. D, update report on domestic violence shelter contracts from Navajo Division of Social Services. E, update report on standing committee budget from Mr. Tom Potero, Office of Legislative Services. 6, old business. 7, new business. 8, scheduling of oversight budget hearing. B, other. 8, close the meeting, announcements, adjournment. Mr. Chair and members, the agenda has been read into the record.
Committee members, how do you wish to treat this agenda that's read into the record?
Motion to accept the
Motion,
agenda.
Monica.
Okay, we'll recognize motion by Pernell Halona, and then second by Edison Wanika. Any other discussions? Okay, we had a request to also include Sage Memorial Hospitals 93-638 reauthorization. That would be in the area of a report. How do you wish to treat that, moving parties?
We can accept that report, Carousel.
That would include Dr. Jill Jim and appropriate staff that would address those items. Any other ones? Regarding BIE, do you want to also include, I think, Emily Arvizo she's the, I can't remember, probably the appropriate word is, or title is the line officer for Navajo region.
Mr. Chair, if I may add.
Yes, Mr. Franklin.
Thank you, Mr. Chair. Actually, there's been a change over in the acting associate deputy director. His name is Charles Sherman. So Emily is, I guess, assisting Mr. Sherman at this time. Thank you, Mr. Chair.
Okay. Committee members, that would be in regard to Che Paul Begay's request from, I think it was a Saturday email from his LDA, Angela Cody, regarding that letter that was sent out by Kara Sweeney on the school reopening. Do you want to include that particular item as part of the Doty report? Would be
Chair, we can include that. I think we need to hear that now.
Okay. Cecilia, Honorable Wanika. Okay, Priscilla. I forgot to also recognize our colleagues, Chair of Law and Order Committee, Eugenia Charles Newton is on the line. Do we have any other delegates on the line? I know we had invited Che, Honorable James, regarding the White Ruins, and I don't know if Honorable Raymond Smith or Elmer Begay would be listening in on that particular item too, because they've been very concerned about how that school is rolling. Committee members, if you can give those three colleagues a text, tell them that White Ruins is on the best agenda. With Ayla, committee members, we have added items, a modified motion to include 2 items. Mr. Mose, a roll call vote to adopt the modified agenda.
Aye, sir. Honorable Paul Begay Jr.
Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Halona votes green. Thank you.
Honorable Pernell Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Winika.
Green.
Honorable Edison J. Winika votes green. Chair, I have a vote of 5-0.
Thank you. Let the record show a vote of 5 in favor, 0 opposed. The chair not voting. That brings us to review and adopting the journals. Mr. Mose.
Yes, sir. I emailed those out to everyone yesterday.
That's for 2 days, right? 2 meetings.
Yes, sir. The 15th and 29th. I mailed them out yesterday. Emailed them out.
Yes. Committee members, how do you wish to treat that?
Chair, so I think we can adopt the journals and just have them read on their own, unless any of the members have any questions on any of them. I read them through, and everything was in order. So I have a motion to adopt the journals if none of the other members have a question.
We have a motion, committee members. Motion by Honorable Pernell Halona.
Second, Doug Plater.
Machine lost its second by Honorable Carl Slater. Questions or discussions on the particular two journals, July 15th, July 29th? There are none. Mr. Mose, let's do a roll call vote.
Yes, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Vote green.
Honorable Pernell Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Winika.
Green.
Honorable Edison J. Winika votes green. Chair, a vote of 5 in favor, 0 opposed.
Okay. Now that takes us to report. The first one, Shimon, Ms. Martinez, have you sent out that? Have you sent out that amended agenda?
I'm working on it right now. It should be there shortly in about a minute.
Okay. So the first one is Doty.
You want Doty first, or you want Department of Health first?
Let's see. How was it we sent it out? I can't.
We had Department of Health first because they were on the agenda from the last meeting, and they did not report at the last meeting, so they ended up first.
Okay. Thank you. I'm trying to find the agenda on my phone, and
okay,
I lost it. So, do we have Dr. Jill Jim on the line? If not, somebody from Department of Health. Okay, so we'll come back to that. Let's go to the second item then.
Oh, man. The Doty was the second item on the list.
Hi, are you still there? Chair So?
Oh, hey, let's go on to the Doty report, Department of Education on school reopening. At the last meeting, we had a pretty good, extensive update by Acting Superintendent Patricia Ghani, and I guess Mr. Franklin, give us an update on how things are rolling. Is there the chance that staff could email Mr. Charles Sherman to provide a report also. I don't know if Ms. Martinez has been able to do that yet.
I'm working on it, sir.
Okay.
Good morning, Chair. So, this is Pat Donnie, Acting Superintendent on the line.
Okay. You may proceed.
Ja, ito ahead today.
Oh,
Ado, Isanos Ingi Ishahat Quagget, Jody update Ninigi, Mishilchonish Ato left Oj a dust Anagohanet, Dodi, school reopening, Ultra Nadneto, Chinahada Ishahigi, Ajabende, Nishigi, Bakashnet, Lesti, Benigi. Ado BIE dan esto of Mr. colleague in legal between Dr. Janet Sloman Chi, aid Hanet Ishla. So I'm hoping that she too is on the line. Again, thank you and good morning for providing the opportunity to address the HES committee this morning with updates from the DODI work group here. Nate Adana question DODI work group. Nalchos itayi lado ultapage yes nil. Yik echo ya school reopening plan hadedi la the shnigo ba nahashne. Echo yangi ya dik adi the mobis kanado wishte ya nanish elkhadet program managers ani blenigi di ultkade school plans nkil yahakine de angi ya beaten that the need a review for feedback is legal. There is no right way of developing a school reopening plan. Neither is there a wrong way of doing the plan. CDC guidelines, safety and health considerations. Center for Disease Control. That not so that the Haiti a principles that the need ado not so yeah. Big echo. Chateau the plan yigi big echo had ado Jody work group stock guidelines is nigi a big echo. Ado Arizona State, New Mexico State, and Utah State. That school plan is legal guide steps ilaigi ishidal hato shefdi nigo school principal lenigi but laidan hit that school plan zigi a review isne we will give suggestions back to the building principals. Have you thought about including this? May I suggest that you also include language about this? Those are some comments that we will be making on those school plans. Our target is this coming Friday to complete those reviews. We will be revisiting to see if there are any common themes in terms of a need area. A is for review. My leadership team, we will look into those and sa tahnaj ja igi da nta do kansigo go shin pe hodozin ado eben nache ya asahnani blin de shin ohot ego technical guidance is linigi ohot abe ka nane liedo lefty principles dan linigi ako di na tos hanadel nehigi ya another guidance document the phased approach go ultra ke hona ango analne chuk ad ya online learning da ultra de quigo shin ultra ita dalia online learning chin da ultra khait ego ya the next stage da not at all da okhot ke hona anigi to work towards return to classroom did kwa anchita the kosan chita nisni igit an it zago shin aden ben ha nahot ito leti ilchine a classroom when and anan tino okhot an ha nahot ito les but do height ego nasol just le ke hon anigi negating criteria digi aje that and dan lenigi percentage nishko sto anal for khanadne. That also is technical guidance to our schools. Ako di ko age asi na tago be nahot iigi ya internet access yisnigi tago be nahot ya did never nahasto baka chino ofka and lenigi ya online learning. Akut ego ya Navajo Nation Board of Education Thursday ya EJ sa be danohadid ahi resolution in support of online learning isnigo ya beji ika yila. Ako agigi akut ego big AD schools at elchinin lenigi online learning di katole. Some are already engaged in online learning. Ako di internet connection yisninigi anit and then hot honestly yishid deligi if everybody logs on. Agigi is stop be nahont e. A call hate ego good bandwidth will yanigi up at zigo be at all niece a co kodo chindonal nishin linigi online learning log on at zago. Do hajoi de no sosigi infrastructure gi beso baka Kodo Department of the Net Education cares at beso o ego yini kego not fos nastinel. Ako di jinda ya not fos beaten ingo ya do sato o ego yistota get it o ago ya not fosigi nes in it's at ego at eshinat no senigi the infrastructure do nesigi ye gonzago ben on nishko a codina hot cell phones and de jaha yishid the deso towers adats ahigi. That is one way of having that Wi-Fi connectivity. Adonana sako yadi fiber optic lines yisne di it's an yahigi de banda scared go ya hot connected net to buildings. That allows for improved internet connections though. So there's that work that needs to happen still to our facilities. Lay chapter house nas nildo ol nas nilgo. Do 8OD increasing the tower bandwidth. That is not going to achieve the level of connection that we need to support teledocting services, online learning, and our employees to be able to telecommute. Adoti kodot anle various departments, but for example, for Dodi, educational data yesne. How many of them are female and male students? Supplemental service that kind of educational data on our students. DBIE net beso chihitet ultra sinaligi di kwage Navajo nahasto baka BIE funded schools. Ultra atana holne. We don't have a shared data agreement in place. A kodi kwa ege hot ego ni ho a igi ayen nan a kwa ege information na linigi b'chadit ol chiligi. We have to call around to get the information. We see the importance for the NED Department of Education to have its own access and repository for educational data. Ochot ab and natchet. Olkap ka na alwa bohonedza. Aji benche in the haunt eat. Ebe ben yesh at the don't niligi infrastructure. Aji dot best of the ye. Yini ked ochot ego a cares ego yanigi best of a proposal ilia. Ako e astishne do sato na handil so do sato akhata. Ako yego ochot ego di han zago shin e ochot ego ni kithan ni do ben kitkhaz jobe et ehigi do ben ta kefigi e yadi ze bit do lehigi had do niligi about a year and a half that's a birachin di satna khido asnigo Jonal Kato, Ochot Ego Shin, Hanza Goshin is Kate Nahas Asto. A ko Aji Gip and yet a hut on Nizago Ochotoljish. So meanwhile, we have to continue to practice social distancing and protect our students from re-entering school too prematurely. A ko Aji Gi Ochot Ego Bansi Kate up and Nahasi. Ado aid oshi nikil behazindole. Ado dinana sako do ad da is nishko last week. Ya BIE de hanne elia. ADBIE operated schools. Ya alchina di classroom manet aya anad zado okuna ol baolta yisnad nishko ot aha ilta September 16th go. Nigo e hot analtos ade nhanna. Eko e han sagoshi e yan nishitla. Ado kodo e ya not hanne enel neko e ya benelnish. The Navajo Board of Education lingi e ya alchina bahasti donald nish bahasti. E but hat inigi e ya di online learning go hanne di alchina oskat nigo e ya sad yet dan hadid ahi khaydi la. President Nez so ochot ego naltos la press release. E di alchina online learning aja papa honet na nigo ochot ego la. A kodi naltos na hanel khaji gi e dobas ikidenel nada. A ko because of that conflict, ochot ego e ya khajo di kwa ege tribal sovereignty din hit the nebnahason linigi kwa ege. We want to exercise our decision making and authority in determining what we believe is safe and what is in the best interest of our students and teachers and our communities. E aje ochot ego benednishko stot esad not asigi DBIE that director da sada Tony Dearman will yeah. Ado yisnad nish sto Assistant Secretary Tara Sweeney will yeah. AD the Mobis kanya da aje ochot ego stot besection hada CZ. Din kinat ani President Nez Linigi e aje konigo ye de hadozi. Ni hidi kwa alchinin linigi ba tit ido ba hanizin. Benenago yadi online learning na hapohonetna. The internet will yanigi infrastructure gi go na habe not nigo hot ego hodosad igila. Ako aji gi iso han so shimpen on the store not for hihit ato ochot ego bened mishko ot Akot oj dast anago ya akot ego be de na hashnet ole isto I do have Dr. Calvin White on the line in addition to Mr. Derek Franklin, who works with the program for Office of Accountability and Compliance. Gentlemen, I don't know if you have anything else to add where I may have failed to cover any of the important initiatives from Dodi. Ashahat Shanad Ani.
This is Calvin White with an education, is to reinforce the comments in the report.
Go ahead.
Yes, thank you. Thank you. Excuse me, Chair. Good to hear your voice and all the committee. Wish you well and good health. This to re-emphasize Interim Superintendent Ghani's report. One of the areas that we're being challenged with is the sovereignty piece of the Navajo Nation with regard to public schools and BIE. We reported, we've been working with the State Departments of Education in Arizona, New Mexico, and Utah, using the Health Command Operations Center information and data, and emphasizing that the Navajo Nation, the data that we generate is specific to Navajo with regard to COVID-19 and the hotspots on Navajo in the various communities. So the question that we've been presenting to these state departments as well as BIE as a federal agent is the sovereignty of Navajo. Should there be an outbreak in a school that's located on the Navajo Nation, would they respect and honor the executive order that comes from council, from the committee, from our board, as well as the president's office, given that they may be a public school or a BIE funded school? So that is one of the issues that we've been working on, and there's been some progress with regard to the State Departments of Education, making a statement in the direction that they will honor the sovereignty of the Navajo Nation. So that's one of the issues that we've been addressing through the executive orders of the president, and it would be helpful with the committee to also have a legislation to support that, to have that legislated that the Navajo Nation here is a sovereign nation, and should there be an outbreak, that we reserve the right to close down any school or any community if that is a necessary avenue to circumvent any community spread. So just wanted to emphasize that issue that interim superintendent has been working on, and us at the education. So thank you for the time and listening to us. That's all.
Honorable Chair, Garrett Franklin.
Everybody mute. Okay. Cecilia, Calvin White, that was quite a message. It caused an echo and really reverberated all across the United States.
Yes, it was.
Oh, Cecilia, good. This Navajo Nation Board of Education resolution igi ni hotado listo. I don't know if it's still Mr. Honorable Edison Wanika or Honorable Purnell Halona. I don't know if you'll be in Window today to see if we can get this legislation going to establish the Navajo Nation position on school reopening and establishing distant learning for this school year. It would be a Hess and Nabi legislation. Quaggy, since you two gentlemen are close by, I would say let's get it, the legislation request form signed and filed either today or tomorrow. At kinsa and we'll consult with the Chief Legislative Council to see if that needs to be an emergency legislation that would go to the Navajo Nation Council. Committee members, that would also be part of accepting this report once we get to the other prospects. Mr. Derek Franklin, Navajo, to the point of addressing the Wide Ruins Community School.
Thank you, Mr. Chair, and honorable members of the HESI Committee. To give you a follow-up of HESI, the request, we did make contact with Wide Ruins Community School. We did request for information from each of our tribally controlled schools in terms of when they plan to begin their schooling. So in particular for Wide Ruins Community School, they have indicated that they have begun on August 3rd. So they're in their second week, and the type of learning that they are administering is a virtual/hybrid model. So at this time, they are in the process of ordering hotspots for their family members so they can have better access to internet. For students who have the internet capabilities, they are implementing that virtual type learning. For the students who still do not have access to internet, they are sending out a jump drive to the students, and with the jump drives where students access their homework assignments. Each student was distributed or given a laptop to work from home so that they can insert the jump drive and begin their homework, and then the school picks it back up at the end of the week. They are also using what they call beyond textbooks, which is the curriculum that includes an assessment type process so they can assess their students and the progress that they're making. So this has been how the school has been actively working with their students at this time within the last week and a half, Mr. Chair.
Thank you. Committee members, at this point in time, do you have any questions for Patricia Garney, Dr. Calvin White, or Mr. Darrell Franklin?
Mr. Chair?
Yes.
Hi, this is Ron Haven, Legislative Council's office.
Yes. Hey.
Hey, good morning. How you doing? There was discussion on the schools opening And tomorrow for NABI, there is on the agenda position of the Navajo Nation insofar as New Mexico Public Schools recommending a delay in opening public schools in New Mexico, particularly schools with sizable population of Navajo students. Okay, now there's been some discussion at the last HESI meeting in respect to this insofar as possibility of amending this particular resolution that's headed for NABI tomorrow to include all schools in New Mexico, Arizona, and Utah, whether they be public, whether they be Indian Bureau operated schools, Year 297 schools, as well as parochial schools, recommending the delay of schools due to COVID-19 concerns of the Navajo Nation. Now, those amendments could be added at NABI tomorrow. I can certainly work on the amendments to be presented from the floor so the position of the nation could be stated to include the other schools as well, beside the New Mexico public schools. Okay. Now, one of the issues I think that the resolution would have to address is the matter that was referenced by the assistant superintendent there, insofar as a virtual learning. That may still be possible, but as far as I know, the resolution that's going through the process is really much more geared towards direct in-school beginning of the schools, where you have students in person at the schools. That's what the purpose of this resolution is for. But insofar as virtual education, I don't know the position of the nation on that, but certainly I'd just like to let the committee members know, as well as individuals there from Doty, that there is a resolution, in fact, that has been introduced, and it will be headed for NABI for tomorrow, at least with respect to New Mexico Public Schools. Thank you very much, Mr. Chair.
Thank you, Mr. Haven. Committee members, I'd sure like to basically counsel the members that, Chair Edmund Yazdi's legislation is directed at the New Mexico Public Education Department. But in regard to the BIE schools and the fact that they're looking at in-person attendance starting September 16th, that one, I think we really need to, let's not muddle the waters. Let's make it real clear that the BIE really needs to listen to the governing body, a committee of the council. So if we could keep those issues separate, it would really have more significant impact. Whereas if we just include everything, then the position almost becomes like a mirage. But if we keep it real focused, I think we get the point across, especially to the Bureau of Indian Education, Mr. Bierman, as well as Ms. Tara Sweeney. That would be my thoughts as we go forward. What AILA committee members, any other questions? So I guess the request again to re-emphasize Honorable Halona or Honorable Edison Wanika, if you could fill out the forms for what Dr. Calvin White presented with that Navajo Nation Board of Education's resolution, and we'll focus it toward BIE funded schools. And I think all the tribal control schools, 638, and contract schools, I think they're basically listening to Department of Education, and I know some have already done their parental. They accomplished getting their survey and recommendations from the parents. Miss Ghani, Dr. White, Mr. Franklin, regarding those surveys, what has been the array of responses from each of the school districts? I know Ms. Ghani alluded to that, but if you could provide more detail.
Thank you, Chair. So, Kodona Ida Kidigi, Department for Education Research and Statistics. That department assisted in polling the parents here on Navajo Nation. We do have that report compiled. I will be happy to share that information. What their feelings are in their children returning to school this coming fall. A great percentage of those parents said they preferred online learning. The parents in Lenigi. And of course, they cited their concerns for their child's safety as the reason for their election and being inclined to opting for online learning. Ados BIE parents survey AD July 20th to Dodi for our information purposes. And the same results there. A great number of parents, as a matter of fact, I believe it was 800 parents of about 1,400 that responded to the parent survey, chose distance learning as a preferred method of instruction for their students come fall semester. And given the overwhelming support and request from the parents, I take that to be a plea of us to be sensitive to their concern for child safety. So I will be happy to share those survey results that have been compiled and those that have come forward from the Bureau perspective. And I just want to go back to information that was shared by Honorable Haven. At the last test meeting, we did get approached by way of a sponsorship by Edmund Yazzie with a student who provided oral testimony with his request for a delayed start. I believe that delayed start request was in response to New Mexico Public Education Department stance that they would be starting in a hybrid model after September 8th. And so the request was to delay that face-to-face method. So we also will be happy to forward the Navajo Nation Board of Education's approved resolution, which is inclusive of all schools here on Navajo Nation with a stance and request for online learning. So HES Committee and NAVI can take that information as they ponder a resolution from their end and legislation if they so choose. Thank you very much, Chair So.
Thank you.
Comment, Chair?
Honorable Halona.
Yes, thank you, Chair, committee members. That was one of the questions I had was from the Board of Education that they did already have a resolution. And if we submit the legislation, I'd like to have a copy of that to submit it with the resolution, to start a legislation for that. And I could get that this afternoon. And also, if Mr. White could write a short response to that, as far as support and reserve the right to shut down the school at any time to circumvent the virus, the spread of the virus, that probably would also help. But the resolution from the Board of Education would be also submitted with that. We can get a copy of that, Chair.
Thank you, Honorable Halona. I guess the other part, make sure one of the exhibits is the parental surveys.
Yeah, we can make that also.
Yes. Okay. What AILA committee members, any other questions?
Chair, so?
Oh.
Elga Paul.
Oh, Chair.
Good morning.
Honorable
Paul
McGee. Oh.
Good morning, Chair.
Oh.
Auto Vice Chair Schneider. Delegate, Honorable Delegate Slater. My brother from over the hill from Winderup. Ado Halona. Charlene. So all those listening in, thank you. This is a very concerning issue, reopening of the schools and how that's going to be put into place. I know that from my area there is a big concern, people voicing their concern against in-person school. So yeah, I guess in their mind, they really need to consider the virus issue that the nation itself has gone through. How hard it was, how bad it was. We are hopefully on the verge of taking control of it and just taking our kids back to school in person. It will restart the whole process again. And I don't say this to put kids down, but they really take things. They don't really take things in a serious note when it comes to groups of students. When they're out in group areas. For a good example would be a playground area. You really have to educate them on the seriousness for safety. It only takes one person to multiply the infected area. It's going to blow back out of proportion again. And parents are concerned about this. Virtual learning. I just want to let the committee know and the presenters know that this issue has been brought to me in my area via emails and texts and in person. It's too early now. We're approaching the winter season. flu season and other type of illnesses can be added onto this. And we don't need to put our kids, the whole family members at risk by sending our kids back into a crowded area in the classrooms. Washington Mr. Dearman, teachers, school administrators, parents, school board members, they are aware of what the seriousness of this issue is here at the local level. Mr. Dearman, we need to listen to the people in the local area. They are well aware of the situations here, and they are in a position to make recommendations for their students, for their children at the community level, chapter level. Quite hard to thank you.
Oh, Sheila, Juno, Pagi, Stan in la, you even the update in a given no. Zoe, Haban said that's the case so late. Committee members, let me redirect the committee back to an issue that's really been White Ruins Community School. Are they meeting by teleconference, or are they meeting in violation of the CDC recommendations? The other is we've had parents come and provide statements to the committee regarding the operation and the work of White Ruins Community School. The other is we've had colleagues express concerns. And right now, myself as chair and Cecilia, Honorable Carl Slater as vice chair have been getting emails from parents where certain of the outspoken parents have had their children ruled to be ineligible to attend White Ruins Community School. Mr. Franklin, Patricia Gani, what and how is, and that's a tribally controlled school, what is Department of Education doing to make sure these students are able to continue their education at a school of their choice? That would be a question that I'd like to hear or see what the Department of Education is doing. Ms. Grani and Mr. Franklin.
Thank you again.
Oh,
go ahead.
Go ahead.
Thank you again, Chair. So, regarding White Ruins Community School, specifically a question from one of our families there regarding the child or children having been deemed ineligible for enrollment at White Ruins Community School. And the question was posed to DOTI for intervention, for a definition for the enrollment criteria. And DOTI's response to that is the schools have an obligation to work with their individual families. As we have noted, tribally controlled schools have their local governance. So certainly there are policies that govern enrollment. What constitutes a completed enrollment application for students at Wide Ruins Community School is of question here. The school principal should be working directly with the parents to help them understand and citing the specifics of why they are deeming a child ineligible for enrollment. DOTI does not have that information, but the school does, based on its policies, and then also through BIE regulations as well, if that's what the school follows. CFR, if that's what they are following in terms of how parents complete an enrollment packet. And so that's what we would hope is being fostered at the school levels to help parents understand what makes a complete application. And if the principal made a decision for a certain student to be deemed ineligible, that principal needs to provide the documentation on the basis for which they are making that decision. And if the parent so chooses to appeal, they have to exhaust the process with the local governance of the school board of that school. And then there is a legal perspective to this as well. So that is DOTI's answer to what's happening in relation to that. Now, the other question about whether Wide Ruins Community School is in violation of convening in public meetings, face-to-face meetings in the midst of a pandemic. I am not aware of that. I have not received a complaint specific to that in my office. So we do have DOJ Alexandria Kinsella on the line as well, who can shed some light from the legal perspective in relation to the children being deemed ineligible for enrollment at Wide Ruins Community School. If I may have an opportunity for her to provide information to HES Committee, Chair So.
Good morning, everyone. Can you hear me?
Miss Alessandra Kinsella.
Yes. Okay, great. Good morning. So thank you, Ms. Shani. And as of now, so this was brought to DOJ's attention maybe about a little less than 2 weeks ago. So I worked with my supervisor and reached out to a few other attorneys within DOJ to kind of figure out, what is DOTI's role, what is DOJ's role in this situation, because it is an individual bringing a complaint against a school, the BIE kind of having authority there. So after reaching out, basically, I think the consensus was that if the parent or her child wants to take legal action, they would need to find an attorney either through DNA or the NNBA directory, because it's within the school's discretion of whether or not to enroll the children. And I think while it may be a retaliatory action, the BIE is the appropriate body to intervene. So it's my understanding that Jody has advised the parent to exhaust kind of the remedies within the school that the school offers, which I think is a great first step. That said, I don't think it's inappropriate for Jody, and I got an email, I think, this morning around helping Jody draft some sort of response or memorandum about the issue generally, because I don't think it's necessarily inappropriate for the nation to take a stance on what's going on. And I think it's okay for the nation to, on more of a political or policy level, to support the ability of those students to continue attending, and certainly because it's virtual instruction, and these children's lives have already been disrupted quite a bit. So I think that would be appropriate. And so I think Ms. Ghani and I will speak later today on what that memorandum will say and help drafting that. But again, if the parent wants to take legal action, they would need to do so with an attorney outside of the nation, because DOJ can only represent the Navajo government. So I think, as Ms. Ghani already presented, Jody's advising correctly, and DOJ will help Jody kind of issue a more public memorandum for the school to kind of at least say the stance. And again, Ms. Ghani, you and I can speak about that later today. Thank you.
Okay, I guess, committee members, do you have any questions regarding,
Chair.
Oh,
We can do this.
Monica?
yes, on
I don't need to hold it.
the list. Oh,
No.
So, Chair, all members of the tax committee, I appreciate this discussion and the reports that were made. And I agree with Delegate Begay on me. These schools, so the different departments, so between needs based on what they're recommended. So that so it becomes secondary. Quite a few other parents. I'm really glad that you recommended legislation to be sponsored by, and I'm glad Delegate Halona said he'll do it. I'll go ahead and co-sponsor that one so we can work on it. But the kids that were denied, the parents are online right now, and they said they didn't get any documentation or the reason for the denial they've been asking for. And then they're saying that the board, they have been meeting face to face. I see as forward. Oh yeah, but the pandemic, I hate to put people in danger. The parents, just like Paul is saying, we're just talking specifically about one school now, White Room. Even though we're just talking about that and there, we're already getting information that is really not good as far as opening up the school is concerned. And I know it's going, if we let those parents express their concern that their children were denied, so they might have to take an executive session. They're saying that they were not given any documentation. I don't know if there's anybody from White Room School that's online that can verify that now. I need a chair, and I think we really need to take a look at this and make sure that the safety of the students and the school staff that Aggie and then parents. Thank you, Chair.
Oh, yeah, Cecilia. Ms. Gani, Ms. Kinsella, Otto, Mr. Franklin. Okay, if we're a tribally controlled school, why don't we develop enrollment criteria? If the particular tribally controlled school answer to Department of Education, then I think we better move forward. You know, in previous testimony to the committee, we've received testimony and accepted report saying that if a Navajo person expresses even one plan in their in their family tree, then they are Navajo.
I don't know what Dr. Fowler.
Without Ajit, I think is the thought that should prevail in determining enrollment criteria. The other aspect is if these students had been enrolled, I don't know exactly how many years they've already attended school there. Why then, at this point in time, are they being deemed ineligible? Is it because of the change in the principal, or it's again that aspect of retaliatory? In this case, a principal is denying education to Navajo students, and that should be that should shake up Department of Education, shake the rafters, shake the foundations that they say that they oversee Navajo education. And that's certainly not one administrator, not one school board should be denying education to of our own children. So what is it? Not only to leho. Alchin dun long ban sa case. Ahwe alchin eat all a ban sa case. A quaggy hazodo lick. I see I do what Ada Heda not Annie Heda a Ohlni Pasalagi what on. I see Yash Hunda. All year to be Ada Kuja. Hajo Harchin in the house after Lake Hajo a in that nasty. He ate over Lake Hut, Neniki ate to Quajo holes in Helen. A quaggy sato job on so case to Lake. Sit. So, Miss Kinsella and Mr. Franklin, a quaggy hajo need be expressed to the school board in those terms. Because you're the ones that have actual oversight in that aspect of how education is delivered. Committee members, If not, then we have a motion by Honorable Halona and a second by Honorable Edison Winika to accept the report, and then from that aspect of doing a legislation that would include the Navajo Nation Board of Education and the parental surveys that was completed, both on the tribal community school, control school, as well as what was shared from Bureau of Indian Education on how parents want to have their children involved in distant learning. The other part, that would be the aspect of accepting this report. Committee members, is there anything else you would want to include?
Mr. Chair, excuse me, this is Beverly.
Oh.
I emailed yourself and the committee members, Mr. Charles Sherman's response. The email was just sent out. From the BIE.
Okay.
Since Delegate Slater, I'd motion to accept the report with stipulations the chair has identified.
Okay. Thank you. Yeah, committee
Chair,
members.
make one comment?
Go ahead.
Thank you. I think in my motion, I'd also like to include a request to the legislative advisor to contact the Speaker's office and the President's office, whichever is more efficient, to facilitate this communication, but to understand what conversations the President is having with the BIE and DODI. If we just take a step back to the reopening plan, or reopening plans across the board, I think that a lot of the communication is best situated coming from one office or one person from the nation. And while we have a lot of important on-the-ground experience in understanding individual community schools, in addition to the public school experiences of our pupils and our students, that we need to be nimble as the science and the medicine and the public health prescriptions and recommendations become updated. And in terms of the nation establishing and setting a policy, we need to, again, be nimble. And I'm worried about us legislating certain positions that might not make sense, if certain factors change. So I think that's one comment going back to the reopening plans. And then the second, regarding wide ruins, I think that the committee really, while we're trying to take the 30,000-foot view and talk about this as a policy issue with enrollment standards, et cetera, there have been a consistent set of issues with this school. But on top of that, the committee is getting bogged down in a lot of administrative minutia and governance minutia of our schools and of certain entities. And I think that we need to take a moment to reflect on our responsibility as a committee to look at policies and laws and strengthen the institutions that are supposed to provide that first level of oversight, that are supposed to adjudicate certain matters. And I'm not necessarily diving into the details of this case right here, but we continue to set precedent in that we can intervene and entertain so many concerns, either directly within the Navajo Nation government or within subunits or tribally controlled entities as they're deemed, even though I don't really know what sort of tribal control we have over a lot of these schools. So I just want us to reflect on that fact. It's occupying a lot of our time, and I think that our efforts are better suited to looking at the broadest possible impact to all of our citizens, all of our students, and that's not to diminish any of the issue today. I just want us to think about that one fact. Yeah, Shania, thank you, colleagues, for indulging me.
Thank you. Committee members, any other discussion? Ms. Martinez, we had already established a motion and a second to accept the report?
Not yet, sir.
Yes.
Okay. Motion by Honorable Carl Slater to accept the report.
Second, Paul Begay.
Second. Okay, Che. Honorable Paul Begay seconds the motion. Any other discussions? And thank you for Honorable Slater. I guess the main thing is how can we best support Navajo Nation Board of Education as well as Department of Education in regard to student eligibility and those other aspects that would strengthen the values, the administrative values that Dodie can use proceeding forward. But AILA committee members, if there's no other discussions, then Mr. Mose, roll call vote, please.
Right, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Lone votes green.
Honorable Pernell Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Winika. Honorable Edison J. Winika. Chair, we have a vote of 4 in favor, 0 opposed.
Okay, thank you, committee members. So let the record show a vote of 4 in favor, 0 opposed, and the chair not voting. We'll go forward with, and thank you, Ms. Ronnie, Ms. Dr. Calvin White, Mr. Derek Franklin, and Ms. Alexandra Kinsella. We'll go forward.
Thank you very much and have a great rest of your day, leaders.
Oh, yes,
Oh, I'll hit 8 only. Oh. So we go to report from
Mr. Chair, this is Beverly. I think Dr. Jim is on the line. Dr. Jim, are you on the line?
Hi, Ms. Martinez. This is Dr. Jim. I finally unmuted. Sorry. Can you hear me?
Yes, Dr. Jim, we can hear you.
Okay.
Okay, we'll go back to item 5A, receiving report. A is update report from Navajo Department of Health regarding CARES Act list. I guess Dr. Jim Deja, you've got the floor now.
Yes, good morning, Chair Shana, Honorable Slater, Co-Chair, Mr. Holona, Honorable So, and Honorable Beth, and Honorable Begay, and those on the call. Thank you. Report on the expenditures or dollars. So we are having ongoing discussions about the report regarding the CARES Act dollar list that was approved on the, not approved, but approved by council, the CJY 6720. And so part of our expenditure plans that we're looking at is, it appears there are funding related to the Navajo land nursing home, as well as also the remaining expenditures that are related to the functions of the public health emergency, as well as, I think, additional dollars for traditional healing, but limited to traditional practitioners. Those are the amendments that were made to the 6720, but I just wanted to go over the main proposal from the Department of Health. At 6720, we proposed operation of alternate care sites and isolation sites. Right now, we are working on the agreements and details with our vendor, our potential vendor, and we are looking at moving the facility between a warm status and mainly an isolation area for the Navajo Nation, and then upscaling to an alternate care site if there is a surge between now and September. The difference between the isolation and the isolation sites and ACS sites is that in an isolation site, there are less medical staffing that are needed to monitor patients that are potential persons under investigation or individuals that are needing to be isolated that don't require hospitalization. And these are only dominantly done right now through the Best Western, or formerly Best Western and Chinle, which is now Canyon de Cheyenne, and also we're working with Navajo Housing Authority. They cover most or all of the wraparound services needed for those isolation sites or hotel sites. We are the only somewhat congregate isolation site that we're going to use, so it can go between an isolation and ACS site. Only other site that we're working on with the Navajo Nation is the Hienta Hotel. We're working on those agreements, and those costs or wraparound services will be provided by the Navajo Housing Authority. But for the Navajo Nation, the only isolation options that we have under a public health emergency is the hotel, or either a sort of a tier level response for the isolation areas. And Chinle is the only site that we have. Shiprock is no longer functional. The agreement between the Tapayaj and Indian Health Service was to operate that facility was terminated as of July 31st, 2020. So we don't have those agreements. The Navajo Nation on that part was only responsible for the wraparound services, but IHS was the administrator of that facility. For the Chinle Community Center, we are the administrator. The Navajo Nation is the administrator of that facility, so we maintain that agreement in collaboration with the Chinle Unified School District. As I was mentioning earlier, the only isolation options that we have for COVID-19 patients are those that go to a hotel or either a tent kit, in which we also call a healing kit. Those are the only options, and if they need further care or monitoring, and if they have other critical issues, they obviously remain in the hospital. Right now, we are monitoring the situation. Our hotel at Best Westerns are not completely full. The New Mexico hotels that are coordinated with Indian Health Services are covered by the state of New Mexico, and so Those are managed through the Navajo Area IHS office working with the state of New Mexico, and those sites are actually winding down. There were staffing issues to maintain staffing at one point. So those are coordinated by the state of New Mexico. And so on this side, we're trying to implement a regionalization approach with the centralized access to isolation sites in Chinle and also the hotels in Kayenta and Chinle. And so those are about the cost estimate of the $75 million. We're looking at $50 million. Within the $50 million, we are looking at management of the entire intake process and also the insurance that goes with it, the liability insurance and the medical staffing. So when we talk about an emergency isolation sites, they will make sure there is a requirement of proper medical staffing. Also, wraparound services that all includes meals, cleaning services, kind of generator to run the facility, any kind of security, fire alarm system to be up to code. It's actually for the Chinle facility, you're providing medical services in a non-traditional setting, but you have to have all the wraparound services that you would need to operate. And so the costs are related to those isolation sites for Chinle for 50 beds, I think it was. And then also we are working on a tent site for non-criminal offenders with the Chief Prosecutor's Office for individuals that would be taken in, working with Division of Public Safety, so those individuals will not go directly to jail if they're presumed to be if they're so likely in that facility for separated from the main facility. And so that's 5 beds site that is in the that we're proposing to cover those type of individuals working with Chief Prosecutor. And then the other 2 is the medical intake and assessment and management of patients as well for the Kayenta and Chinle, because in the agreement, Navajo Housing Authority is only overseeing wraparound services, and the Navajo Nation is responsible for medical services portion of following up and doing well checkups for girls. And right now, the Navajo Area Office is assisting with those responsibilities. But and going forward, we would have one vendor coordinate all of services for the hotels and also the tent site and also the Chinle site. Those are the costs that are estimated for the individuals' price. The remaining dollar amounts will be related to medical EMS for needing vehicles. We were able to work with Navajo Housing Authority dollars. They were able to assist us EMS vehicles, but we'll have to make sure there's adequate funding for their updated equipment. So there will be some funds allocated for the equipment. There will also be mobile units that we're looking at, the providing of the kind of COVID-19 testing, or also the mock test flu. So we do need mobile in order to conduct education, screening, and also that we're capable of providing and coordinating with the health facilities. So the items that we're talking about here for that's being presented by us is benefiting all healthcare facilities in response to the pandemic. So any of these mobile units is our intention is to continue to collaborate with the facilities. And right now we're putting together a vaccine group between a 630 IHS and a Navajo Nation person to make sure there's coordination of right now with the flu and COVID-19 vaccines when they do occur. So there will be a select group of individuals that will be coming together to coordinate these areas of providing education and also the vaccine shots itself. We did get a cost estimate for those mobile units. They're a little bit over $500,000 with those mobile units that we've seen in other areas. But then currently the Navajo Nation does not own any mobile units to provide this sort of function to the community for public education and prevention. The second part that we're looking at is COVID testing and vaccination for adults. And so right now there will be not as much, there will be dollars that will be decreased for testing and vaccination as the dollar amounts from the 128 went down to 75, but there will still be allotted some sort of funding for those when they're made available. I know that vaccines are in going into their phase 3 trials. We hope that we're able to access that. But for COVID-19 testing, I know that we have not been able to provide any kind of consistent or what they call serial testing for our Navajo Nation employees. And also on a consistent basis, their testing are only done when there are potential exposures. So with access to this funding, we hope to provide regular testing to our employees to make sure that we're able to make sure that there aren't any exposures that we're aware of within the Navajo Nation. So their testing availability for COVID is slightly changing. There are now a variety of testing that we're aware of. There is the regular nasal swabs that they do where they put the Q-tip up your nose, or either there is other saliva testing that are also being conducted, and also there are antigen testing and antibody testing that we're not going to go into detail, but those will not be included. Right now we're only looking at some sort of diagnostic testing will be covered under these funds. But right now the going rate for any kind of CMS, Center of Medicare and Medicaid Services reimbursements are about $100 per test right now, is what the charge is for a regular standard COVID-19 test. So there will be some dollars allocated to that, but the other amounts that we're looking at is the contractual services for surveillance, case management, public health services. As you know, that our EPI team is only a handful. I think less than 10 are included in our EPI team. We are working with making sure we're not duplicating any dollars with other external funding that we are receiving. So with the epidemiology dollars, we're looking at capacity building and regular reporting with ComCare. ComCare is a device that's being used for case management and for contact tracers, and there would need to be a large IT structure, and also just as the schools are preparing for using technology and updated laptops, that has been missing in some of our existing CXR and PHM programs. So some of the funds have already gone to purchasing those items for them, but otherwise we are looking at getting support staff to conduct these. Our EPI people are performing these daily reports 7 days a week. I hope that we can get some support for them, and also to look at building capacity for the EPI Center. But we are working with the Indian Health Service and tribal health organizations on a daily basis to maintain the COVID-19 reports on a daily basis. And it is around expanding workforce, because we need to ensure that we have also enough or contact tracers that are available as well for us to detect if there are any, to detect outbreaks and respond to outbreaks. We need to have sufficient contact tracers. And right now, I think the numbers are looking at what I understand possibly be for one positive case, it's either 5 additional contact tracers or I'm trying to see the exact ratio that we have, but right now for us to function at a full response on the Navajo Nation, if there is a surge, we're estimating about, depending on what we've experienced before, about 150 contact tracers would be needed. There are that many individuals trained and available, but there's also the issue of how healthcare facilities and health services are going to be integrated back to some sort of not normal operations, but because that's also their source of income. Is right now hospitals are not doing a lot of third-party billing and only relying on telemedicine. So you will see there will be other types of health services that are being opened back up, such as dental services. And a lot of these employees that were contact tracers that was their primary job. So we're going to have to balance and figure out how to also make sure we have sufficient workforce to respond when there is a pandemic and when we do have accessibility to contact tracers that are trained, and there is a workforce that we're working with an organization with some of the other dollars to look at data support and also supporting some contact tracers in the meantime. There's also food delivery for senior centers is also a CARES Act dollar amount that is allowable, and so the majority of the funding will go to supporting somewhat the Meals on Wheels concept, where there are vehicles that are capable of doing safe food deliveries that are provided at the correct temperature, and also looking at warmer bags, also the tools that you need to seal your home delivery trays is what they call it, that most of the senior centers are looking at. We're also looking at making sure that to prepare meals safely, looking at kitchen equipment such as a new refrigerator, stove, and also a freezer as an additional, I guess, equipment. I know the updated facilities across the Navajo Nation for these items all vary, and so there should be an assessment that's being conducted right now for all the senior centers to see about their equipment and their whereabouts with their updates of those items that I just mentioned. So those are an overall summary of the CARES Act dollars that we're proposing, and that was proposed through the CJY 6720. So I just wanted to provide that summary again, and I'm open for questions. Thank you, Shana.
Sheila, it's been a while since we heard your voice, and thank you for coming on the line to give us an update. Committee members, the floor is open for questions or statements.
Doug Slater. Chair, can I ask a question?
Oh, Honorable Vice Chair Slater, go ahead. I was talking to myself. I had it on mute, but I'm back on, so go ahead.
Thank you, Dr. Jim. Appreciate the update and report. I believe in the expenditure plan for the Department of Health that there is a requirement for a cost-benefit analysis for the various methods of treating COVID folks or suspected COVID folks. And I'm curious whether the department has initiated that process yet, or if you're going to wait until the president signs or line item vetoes it to initiate that process. I think that if it wasn't expressed during the time when the amendment was added to the legislation, the the council is very interested in getting some stronger justification for the alternative care sites. And I think that justification is definitely there in theory, and that is, of course, it's going to get cold, and people are not going to be able to take those healing kits home and live in a reasonable way. They're going to need some sort of location to heal, and I think it's very reasonable when we do, potentially see a spike in numbers, that people will take that sort of personal responsibility and segregate themselves from their households without needing any sort of legal intervention by the Navajo Nation. But I think that's the first question, is if the cost-benefit analysis process has been initiated. Because I think that, again, when a potential second round of funding becomes available, or when we have this look-back period on October 1, and we need to see, well, where is funding being spent and where is it not being spent, I want us to be able to move quickly to support the Department of Health and reprogram funds for a potential surge in infections as we head into this winter. So I want us to be prepared. That it necessitates the data and the analysis, and I think just being able to express that to the whole council. And I might have some follow-ups later, but yeah.
Committee members, do you have any other questions before we give the floor back to Dr. Jim?
Thank you, Honorable Slater and Shinasa. So in the legislation, when it does get passed, I guess I just have to be prepared to schedule a meeting to go before the HES committee to provide the cost-benefit analysis. Is that my understanding, Honorable Slater?
Yes, that's in the expenditure plan, Dr. Jim, and it was required because of a lot of hesitance to setting aside the $75 million for the alternative care sites right off the bat. And I also would like an update on where we're at in the contracting process for the operator of the alternative care sites too. And in terms of scheduling that meeting, it could be a regular HES meeting, but I know that the chair and I will, as soon as things are signed, as soon as we can legally do it, which is at least 24 hours advance notice, we'll have that meeting with you. So thank you.
Yes, thank you, Honorable Slater. We are and we have defined the expectations for the delivery of services for the contractor. I guess my next step is that I probably need to schedule a meeting with the HES committee to present those the findings, because in the legislation it does state that if you don't deem, or if you don't think that's justified, that it might not be approved, is maybe possibly how I'm interpreting this. So I will provide a 24-hour notice, and I would need to better understand the cost-benefit analysis definition. So is it okay if I'm able to to communicate with the committee on the cost-benefit analysis report that I will be giving, so there isn't any misinterpretation after I consult with the experts in the isolation and the individuals doing the cost estimations?
Dr. Jim, I think that'd be great. I think, if my colleagues here would like to chime in and provide some guidance as well, I think that's a great idea. But, there's, I think, different ways of analyzing it. You could have the cost per patient. You could use some of the data from how it worked in the past. You could speculate on how it might work in the future on that cost per patient. I think it'd be helpful, the cost-benefit analysis doesn't have to just be, numbers, right? It can also be a matrix that says, look, these methods of treatment and isolation, et cetera, aren't going to be available when it's cold, or we envision this happening. And that's the sort of information that will be helpful to the committee and to the council in understanding what the Department of Health is working on. I think things that the program intuitively understands because of your expertise in epidemiology, et cetera, and in combating the virus right now, don't necessarily translate into what we see as leaders when, say we see a lot of money going into an effort with very little usage and something like that. So that's where I'm just trying to give you some guidance on how to come back and present that information to us so it's most meaningful. And then, we appropriated a little over $75 million. The request was for $128 million. I think my request to the program is if you can also come back with some sort of phase planning. Say you submit a secondary request to the nation and say, we need this for senior centers because we spent all of this on ASCs. We need this for vaccines because we spent it on senior centers. Whatever that sort of update and follow-up is going to be once the president signs it into law and you have your marching orders, then we can work together on getting more funding to the department. Because I think that, ultimately it's the nation who's combating this virus. There's all these other people who have obligations and responsibilities, but the only people we can trust are ourselves. And this is a moment for the Department of Health to level up. And I really think that you guys are on the right path in doing that. But let's do it in a way where we have the data, the theory, and everything to support it, and we can communicate it clearly, not just to political leadership, but to those sitting around their hogans, listening to KTNN. And to that end, when it comes to the vaccines, I think, or any sort of expenditures that might be tied to a certain timeline, please, keep the committee updated and the legislative branch updated, so that. I'm going to be frank. I think that it's very unlikely that a lot of these infrastructure projects that were funded will be able to be completed because of, potential infections, supply line issues, all sorts of things that may affect the delivery of these programs. And we have an obligation to get that funding to our frontline workers like yourself and your staff. So, that'll be helpful down the line, and we're happy to continue that communication. Thank you, Dr. Jim.
Thank you, Cecilia, Vice Chair Slater. Good dialogue. Committee members, is there anybody else that would like to ask a question or make commentary?
Chair, this is Alona. Delegate Charles Newton.
Okay. Let me go to committee member Halona, and then after that we'll go to Honorable Chair Charles Newton.
Thank you, Chair. Good afternoon, Dr. Gill. Jim, I was curious to see, have you heard or has the CDC did any analysis yet as far as the flu shots this year and what type of flu that might be coming out for this winter? Every year they always have a flu shot that they put together for the community, and I just was curious to see if there was anything out yet as far as the flu shot, other than the virus, the COVID-19 virus, and when will the flu shots become available? That's my question, Dr. Joe.
Okay, thank you, Honorable Halona. We don't have information about the type of flu shot there'll be, the type of strand they'll be targeting, but I can follow up with CDC on the type of strand that they're estimating they're targeting for the flu shot. I don't have the information, but flu shots or vaccines will be available in mid-September. And for those reasons, we are putting together a team to use that as a way to also practice for the COVID-19 vaccinations, which sometimes they call as exercises or mocks, but it's a real flu shot. But we're coordinating. Hopefully, through that coordination, we can ramp up our exercises for the COVID-19 vaccines when they become available. So, thank you, Honorable Holona.
Thank you, Jill. Appreciate that.
Okay, so Honorable Chair Charles Newton, you have the floor.
Health Committee members. Dr. Jam, thank you for the presentation and also for preparing for your committee by putting this report together. It was very thorough and it provided a lot of information to me listening in. My question is, how are you planning to implement the traditional healing that we talked about during the passing of the CARES Act? We had conversations about the Navajo Medicine Men's Association, the Hotchkiss Association, we talked about how they should be a part of the plan to help heal people, and many of our people who are traditional have been seeking out these services from many of the medicine men who are out there. So if you could share with us your plan on working with the Medicine Men's Associations, the Hotchkiss Association, and then the Azeka Navajo on healing the individual, because I think that healing the soul is really the first step in healing the body and the mind. And healing the soul does require a lot of prayers which many of our people believe in, and then also the church-based as well. I believe in prayers, so I'm not afraid to go to any type of church when I get invited, because to me, prayer is prayer. So I wonder how the Department of Health plans to implement that into their program and to start spending money to help heal the soul. Thank you. I'm going back on mute.
Thank you, Honorable. Thank you, Shana, and Honorable Charles Newton. Yes, we are having conversations about the traditional, including all the traditional and other individuals, the NAC, and also faith-based support services. And we have to go back to what's allowable under the CARES Act dollars. There are dollars I know that have been allocated under the DED for hardships, but also with these dollars, there are some allowable expenses that we're looking at, is working with possibly Diné College, looking at coordinating and helping with this initiative to look at mental health services, or either in that part, not mental health, but improving your well-being and while you're living in COVID, and then also re-looking at the safety guidelines and procedures when ceremonies are going to take place again. I think we're going to have to rely on their expertise on making sure and working with the appropriate CDC guidelines that will be set into place, and ensuring that we have some discussions and work sessions with the different entities involved under this scope of funding. And then in the meantime, I hope that we can work with one of the entities, or either with them, to provide these type of public health response to COVID-19, because we are still all healing as a nation. I think the pandemic has set us apart and has interfered with our daily living, our mindsets, our well-being, but we're all resilient. And I think as we move forward with COVID, we definitely need to address a lot of these through our own faith-based or NAC, or either with the traditional practitioners, but possibly working with Diné College to coordinate all of that, but making available to employees throughout the Navajo Nation, enterprises, or schools some of these protective factors that we can look at that can be made available via web that can be given to students or either adults to make that more accessible so we can begin to heal and grieve, and in some cases for those that we've lost family members, and how to live with COVID-19, I think is definitely a challenge every day. And so that's kind of the intention of this funding. The way I see this is how do we heal? How do we heal within the nation using our own resources and making sure that we're still in compliance with the CARES Act dollars is my vision for these dollars that are going to be set aside. So I may not have directly answered your question, but that's kind of the my initial interpretation of how we are responding to COVID and in our current situation. So thank you, Honorable Charles Newton.
Committee members, any other questions or comments? Ms. Martinez, have we established a motion and a second to accept the report?
There is no motion yet on this report. Mr. Chair, I have a question for Dr. Jim. This is not related to the CARES Act list, but however, it's related to the budget for Navajo Department of Health. I sent out an email requesting for the exhibits from each of the divisions, and I have not received Department of Health exhibits, and they need to be attached to the legislation. I just want to update where her budget exhibits are. Thank you.
Dr. Jim?
Thank you, Ms. Martinez, for that question. We should be finalizing those exhibits today. We submitted our budget, but there were some minor issues that needed to be fixed with our aging program. So we will get that out to you as soon as possible. Thank you.
Thank you. Then also send it to Mr. Haven, Ron Haven. He's in charge of the legislation.
Okay, committee members, chair is open for a motion and a second to accept the report.
Delegate Helona, motion to accept the report.
Second, Juanita.
Okay, thank you. Honorable Helona and Honorable Juanica. Any other discussion?
At this time, no.
Okay.
Chairman, so this is Delegate Crotty. May I ask a question?
Sure. Honorable Amber Knuzbach Crotty. Thank you for joining the call.
Committee members, thank you, Dr. Joljim, for your report. I'd like to I'm concerned with the kinship packages that were sent out. What's the plan, and what have we learned on what works best for assisting in isolation for either community members who need to isolate or who are positive?
Chima, can you repeat that again? I missed one word in your first question. Sorry.
So my question is for, you mentioned the contact tracing. I really want to hone in on the isolation plan. And I did see that nearly 500 or just under 500 these kinship packages were given out. So that's basically a chant. But my understanding in speaking with individuals who were trying to isolate using these tent kits, it's a challenge. What they did was, and I don't know if information was provided to the committee on then what happened and how they used the tent, but it was very hard for them to be up in the mountain with a tent kit and not having adequate hydration. Matter of fact, we were concerned on the safe being of some of those individuals. And so what's a better way for the nation to address the isolation for possible positive cases or individuals who need to isolate if they've had a possible exposure? Thank you.
Well, thank you, Shema, for that question. The isolation kits or tent kits are usually, they're given options when a person is discharged from a hospital that needs to be isolated. They're asked do you want a tent kit for your home so you can live near your home, because there were individuals that don't want to go to hotels. So those that was the option for the tent kit. So that way they're there and they can be, like if there was a mother that tested positive and their kids are in their home or something like that, the mother wanted to be still within distance, and that's why the tent kits were provided for those individuals. So it was basically they did self-identify needing that. And so then there's also the ones where they're for making it more for the fall, coming in the fall, I think what we would have to coordinate to make sure that we will stop using tent kits at some point due to the weather. And so all of those individuals will be going to the hotel or either the Chinle facility. And all together, you're looking at the 50 beds in Chinle, and then we have 40 rooms in Chinle, which is 90 rooms together, and 20 rooms with the capacity to expand to 60 in Kayenta. So you're looking at about 110 rooms right now. And we're a population of about over 180,000 or so individuals, depending on what denominator we use. And so there's just to be on the safe side, you're looking at over 150 individuals on the Navajo Nation. And we're only, if you're talking about costs, we're only setting aside about 110 rooms that supports full wraparound services. So the option is, yes, there are tent kits are there, but those are really they make that choice to receive a tent kit rather than go to a hotel. So as we're going into the fall, we're going to have to recommend, especially if they're older or they're obviously due to weather, the only option you're going to have is Chinle Community Center or the hotel options that we have. And I hope that answers your question, but the isolation options are given to individuals if they don't have the capability of isolating within their home or at home. Because some might already have avenues of isolating, like in a separate bedroom, and they know how to properly feed the person, and they might have a separate bathroom. So there's the home self-isolation that they're able to do, but when they're not able to do that, those are one of the questions that are asked during the referral process that they have to answer. So if they say they have an ability to isolate at home, or if they have the ability to isolate at home, it makes them ineligible. So those are like some of the criteria that we worked on with the Patient Mobilization Center to intake patients. So I hope that answers your question, but going forward, I think due to weather and if there is no ability for someone to self-isolate, it will be, most people will be referred to Chinle and the 2 hotels. Thank you.
Vice President, I don't know what to hear right now. Vice President Warren, Senator and Admiral back there. But just wanted to give a shout out to our Navajo Nation post office who we love and adore. So, Vice President, great.
Chairman, may I ask another question?
Thank you for your
go ahead, Shema.
Always be proud.
Hey, somebody go on mute.
Thank you, Chair. That sounds like an agency uptake call, so maybe speaker staff who's monitoring this call can mute that line.
I think we're being trolled. Great.
Clear it up.
Thank you.
Okay, thank you. So Dr. Jim, what I wanted to, my thank you for that information. My concern was, although the individual requested a tent or kinship kit, there was some challenges. So what's a better approach in helping with isolation? Hearing from my colleagues and on the debate for the immediate housing needs, there in that amendment for housing is, to the point of even purchasing like travel trailers and looking into disinfecting or sanitizing in between community members who may not want to be in a hotel, but want to be closer to home. And so is there any idea of where they pitch their tent? My concern was coming across individuals, especially in the mountain areas, who were, pitched a tent, but they weren't doing well. We had to, make sure they had water. They had other needs. And so that's my concern. What did we learn and what can we do better? If you could.
Yeah, thank you, Shema, for that comment. And I think we have to create more awareness of these hotel options if they're not fully able to isolate. And isolate is only something temporary. We have not looked into any kind of mobile option right now. And so, and due to our capacity, we can look into other options. But I think if there are individuals that are not able to self-isolate safely, I think that would be the best recommendation from those if they don't have enough food or water. There is the hotel option, so they can do that. Given that I don't know if it's inconvenient for people if they have to make sure they tend to their livestock, but a lot of our awareness around preparing to go to the hospital in case you have to be there for a long time, we try to give education about making sure that someone helps you bring food, or either you've identified all your emergency contacts. So if there isn't a person that are able to do that, those are the options that we have right now, because if they're in a hotel setting, some of those patients have gone worse. And so when they do get worse, the EMS is right there to transfer them to the hospital. That's why those isolation areas are near a hospital, so they can intake patients. So that has happened. Some of them, they do, most of them, they do safely recover. And so that's what we want within the 14 days. It's a temporary stay in order to, if they're not able to self-isolate safely. So I think that's what we're looking at, is self-isolating safely if they're not able to do that at home. Right now, those are the only options we have, but we can definitely talk with the isolation team to see if there are other options moving forward, like you mentioned. But thank you for your comments and the lessons learned that you're talking about. I will bring that back up to the command center team about isolation discussions regarding what you mentioned. But for those comments.
Thank you.
Committee members, Shema, Honorable Crotty, do you have follow-up? Or give it to another?
Thank you, Chair. My only follow-up is really the wish of the committee. I could have a meeting directly with Dr. Jill Jim's team, or does the committee want an additional report? I'm at the service of the committee, but I do believe that we should look at what are some better options. And what I also want to say, I know some of our communities were concerned when when we had presumed positive cases and they were still within the community. So I'm just trying to make sure we learn, those are lessons learned and how we move forward. Thank you, Chair. If you could give any guidance, or I could have this conversation offline with Dr. Jill Jim's team. Thank you.
Chair, this is Monica. Oh, Cecilia, go ahead.
Yeah, I really glad that Delegate Crowley is expressing her concerns in reference to what's going on right now. I think we really need to concentrate on establishing an official Navajo Nation emergency response plan. Because right now, we just react when there's an emergency. There's supposed to be agreements with the schools, with the hotels, and everything. If there's an emergency, if there's an evacuation, there's supposed to be agreements already established with the schools, with the cafeterias, with the dorms, with the stores within the community, if anything should happen. So the response would already be in place. But right now, because the Navajo Nation doesn't have an emergency response plan, we just react to what happened. And that's what we're doing right now. That's the reason why we're having a lot of problems. I think we as a health committee or the resource committee should initiate putting together an official Navajo Nation emergency response plan. And then we can continue to enhance that plan to ensure that we address any emergency that should come to the nation. So based on what Delegate Crowley is saying, I think that will be, instead of just fixing this and that, we think we need to really do a plan for the nation, and that will go on to the communities and whatever emergency that we might experience. I think if we have an official Navajo Nation emergency response plan, that will really help us.
Rasheen Cecilia. Good. Oh, Honorable Halona, go ahead.
Well, thank you. Thank you, committee members and Dr. Jill, Jim. On the motels and the sites where the people go to that have COVID and the ones that heal up. I know that in the motels that they have a physician, a nurse that comes by and checks on the patients, right, at least once a day. On the care tents, the one that you give out, is there any information with that? Does a physician or a nurse or anybody go out to the home where they have their tent set up to check on them, or is that just give them the tent and let them pitch it up wherever they want, or is there a protocol for them to have it near a home, have it near water, facility for the bathroom and cleaning and stuff like that? Is there any protocols for that, or is it just give them the tent, let them put it up wherever they want? Because, according to Delegate Karate, those people are putting tents up in the mountain. Of course, they're going to need some attention. And it takes time to haul water there and have a food supply. So is there any protocol to where they need to put up their tent? And then also, is there any physicians that are assigned to go by and check up on them at a later date, like they do in the motels? I'm just curious about that, Dr. Jill. You enlighten me on that. Thank you.
Thank you, Honorable, for that question. There are processes in place for those that are with tent kits and also those that are positive. There are case managers that are supposed to be following up on a regular basis with these individuals when they do get in contact with the case management team which consists of all the public health nurses, also any volunteers or either, I think CHRs in some cases, but mainly medical staffing such as public health nurses do follow up on the patients till they get better. And some of their daily responses, if you come to the command center here one time, we can show you in Doty, they have a case management call line where they're all, the individuals sitting there is all they do is follow up by via phone with their patients until they're better, and their packets are pretty thick regarding their note takings and their case notes for those individuals. So I hope that's being implemented all the way across, because it's really the responsibility of the public health nurses and the health facilities. So the pandemic is a response from the health facilities, but also is overlapped with tribal programs and also combined together with some volunteers. So yes, there is follow-up with those individuals. Thank you.
Follow up really quick, Dr. Jill. How about where they when they give the tents to them? Are they told that they need to be near a facility or near a home, or because Della Karate mentioned they're up in the mountains. That doesn't seem appropriate for them to be running all the way up there to pitch their tent, unless they're having to watch cattle or sheep or whatever. I'm just kind of curious about where are they told that they need to.
Yeah, go ahead.
That was the extent of my question. Just are they told where they need to be close to a facility or close to home or?
With that information from the case management, most of the recommendations should be that they are near a home or where they can, if they're able. So let's just put it this way: there have to be, if they're home self-isolating at home, there's always the recommendations. Obviously, if they live at home by themselves, they can take care of themselves and they won't be exposing themselves to others. And or if they're going to self-isolate at home, there should be a caretaker, someone that's going to give them food, someone that's going to make sure that they're able to clean up after them if they go to the restroom, if there's a common restroom use, or there has to be some safety guidelines in place. And so, I wouldn't, if they're going out into the mountains to self-isolate, that's probably their own choice, but they have to make sure that their advice should have been that they're able to take care of themselves and not be far away from the facility if they need to go to a hospital, because in my own understanding of COVID, COVID can really change within 6 hours. A person can be just fine and all of a sudden start dealing with respiratory issues. So they would need to immediately go to a hospital if they need to at the time when they're now using ventilators and whatnot. I think some are still using it. Some were saying it's not effective, but it's basically to help them breathe. But even that emergency response, I don't think that any of the advice would be going to the mountains away from any kind of easy access to a health facility would have been recommended. I think they probably would have told them and advised them to make sure they stay near home until they're fully quarantined, and it probably is their own individual choice. And even though I'm not blaming the patient on any reason, but this is a new disease. What we learned from the beginning has evolved over time. We now a little bit better understand all of the different types or how to deal with COVID. Before, when it first started, we really didn't have a clue as far as responding to a public health emergency regarding isolation and regarding there were recommendations from CDC that we were doing. But I think what we're now having conversations, how do we learn and recommend making sure people are understanding how to deal with COVID and quarantining, making sure you're staying away from people when you're sick and whatnot. So I think we've learned a lot, not only in the nation, but we've learned based on our experiences, and some of those didn't end up so well. But we heard stories, we heard how people have reacted to COVID. It really varies depending on your experience, your age. But I think I would agree that I don't think the advice would be going too far away from your own home for someone to immediately have you go to a facility to get help if a person gets worse. So that would be my response on behalf of the public health professionals that provide advice to their patients. Thank you.
Okay, thank you, Dr. Jill. Yeah, just wanted to make sure I got that clear. Yes, I do believe that they should be near some sort of a facility in case they do get sicker. And you're right. I have seen the same thing, that a person can go down within 3 to 4 hours, even 6 hours, even though they hadn't been feeling any duress under the strain of COVID. Okay, thank you very much, Dr. Jill. Appreciate it. Chair.
Thank you, Honorable Helena, Honorable Crotty. I guess the main thought is the case managers. Are they with Department of Health or are they with IHS?
Thank you, Shana. Case managers are all of those, 638, IHS, tribal employees, volunteers, and CDC is there to assist case managers in Kayenta right now. So they're a mix. And I think that's one representation of our unified command structure. There's a public health branch and there's a medical branch. And under the public health branch, that's where case management is overseen by IHS and a 638 person and a Navajo Nation person. So the field of public health right now, the response is a mix of everyone. It's not just solely Navajo Nation or IHS or 638. It's volunteers and above all those other entities. So the work that we get done every day is by a number of those responsibilities, and they're being shared and coordinated across all the service units. Thank you.
Okay, as a follow-up to what Honorable Crotty brought up, is with the ice chests that are distributed, is there a follow-up to restock? Water or juice or any other liquid so that they remain, I guess, and even restocking with other food items to restock the ice chest with ice. Is there that type of follow-up?
Oh, thank you, Shana, for asking that question. So the type of, for under the COVID-19, I can only speak for that. There is a humanitarian branch. I don't, and I'm not familiar with their distribution. But on our site, when we're dealing with COVID-19 patients, the food boxes are either given for a person. If it's in a tent, it's non-perishable items for 14 days. If they need more supplies, they will request, and we will support them that way to get more food for them. There's, if there is a family, a cluster, a family that's exposed, then they get a family food box that includes eating at home. We made changes to our current menu of food boxes. We did get feedback from some of the COVID patients. Some of them were indicating they wanted more softer foods, something that's easy digestible. So we are changing our food box based on some of those comments that we received. So we'll be submitting an order for those food items with our local vendor Basha's. We haven't ordered or purchased bulk foods, but we're going to have to with this new legislation and some of the funding. A lot of the food boxes were being donated, and those have run its course. So we're not relying on donations right now. So we're going to have to rely on the funding that was allocated for food. But I've heard cases where earlier on, when there are patients that don't want to increase their risk, but they gotten better, but they usually want food, so they don't want to go grocery shopping down. No, we usually accommodate those kinds of requests too. So they vary, but we have relied on donations, but now we're creating a menu. We're working with the Navajo Nation Special Diabetes Program, their nutritionist individuals, to redo our food boxes. So, but they are for 14 days, and if they need more, we usually have the ability to give them more if they choose to. Thank you.
Okay, committee members, any other aspects? But I think in accepting the report, I think we also need to really listen to Brother Honorable Edison Wanika's recommendation about establishing an emergency response plan in regard to some of the details that we've been apprised of in the previous report as well as this report. Perhaps a multi-level work group committee members.
Chair, this is Delegate Henio. Can I ask a question?
Oh, Chiche. Yes, you certainly can. Thank you for joining the call. We appreciate your presence. Go ahead.
Yeah, that's Chair. Chair, so I just the Health Education Human Services Committee. Those just one question. I'm listening on the reports here. At the same time, I'm listening to Rama chapter. Let me turn this one down. And so with this, just one question as far as for Dr. Jill Jim and Health Command Center. These motels or hotels in Gallup, there's COVID-19 patients. Are there in isolation, recovering after the hospital they're placed there? And so the question is, who is actually overseeing the hotels to see if they are providing acceptable services to the Navajo clients? And is there a regular inspection of the hotels and interviews with the clients to see if everything's in order? And then at the same time, what kind of commitment do these hotel owners have to the Navajo Nation in providing safe and sanitary housing? The reason why I'm asking is because I have a community member from here that went to the hospital, and from there, this person was referred to the local motel, which is Days Inn in Gallup. And so, upon the safe return of this individual, it was reported that the conditions were very, very poor at this hotel, the Days Inn, and to a point where this was during the monsoon season in the middle of July, and this person experienced leaking roof. Water was actually coming through the roof into the hotel room, and so this person complained to management and housekeeping, and all they did was told her, "Here's the mop. Go ahead and mop it up." And they just left it behind by the door and walked away. And so at this room that this person was staying in was reported as moldy. You could smell that mold because of the constant leaking of the roof. And then at the same time, when it came to meals, they were just given cold soup with crackers, and that's it, on a daily basis. So I don't know how much money we're paying these hotel operators, Navajo Nation, for paying the premium price for a night stay for an extended period of time. I believe we should be receiving those type of services, and there should be some sort of surprise inspection going on at these lower motels. It's not a Hilton, it's not a Marriott, but at least we're trying to provide help. At the same time, they need to meet us halfway to provide safe and sanitary conditions. So, I just if you had long for allow me to ask a question.
Oh, Silan, Che, Honorable Chair Hino, Quaggy saying, Dr. Jim, you have the floor to respond to the question and the concerns.
Yeah, thank you, Shana, and then also Honorable Hino for asking that question. The question regarding the Gallup motels, the Navajo Nation or the Navajo Health Command Operations Center are not part of that agreement. There's no agreement with the hotels or either with the state of New Mexico regarding the operations of those hotels. Those hotels that were not included in are those that are in Farmington, in Gallup, or in Albuquerque. The agreements that we have direct control over are the Chinle and soon to be Kayenta one. And so those agreements are between the state of New Mexico, as I mentioned, and also either Gallup Indian Medical Center doing those follow-ups. So I would bring that up to the Navajo Area IHS office, and also they probably partner with different volunteer organizations too, but it is under the state of New Mexico. I believe they are the payer of those hotels and with the agreements. But I would like to see if we can bring that up to the Navajo Area office to see if we can work with them on addressing those concerns. So I can certainly share that with the Navajo Area IHS team through the UCG group here regarding your concerns. And I know that our hotels, the hotel agreements that we have, we do ensure that there is adequate food or sufficient food that are being provided. And it's unfortunate to hear that one of your community members had a poor experience of the services. So I just would like to share that with you and address that to the UCG group on those concerns. Thank you.
Sheila, Mr. Che, that provides some clarification on how the Gallup items are being taken care of. So the committee will also do a follow-up with Navajo IHS, and we'll see how we can get some of those items addressed. Committee members, do you have any other questions? If not, then Shadeja, regarding right now, because of the many issues and all the data that's being generated from how we're dealing with the pandemic and whatnot. What all this aspect, I think there's some universities. I think there was University of Utah, ASU, UFA, NMSU. They were, I guess, doing independent and even, I guess, in the area with National Institute of Health, as well as the Center for Disease Control. They're doing some research studies, and I'm wondering right now, is the Navajo Nation Human Research Review Board, are they basically convening and those research items, are they being presented to the Navajo IRB? That would be one item that I had written down as part of the items that we needed to hear an update on. Dr. Jim.
Shana, thank you for that question. We are having ongoing conversations regarding certain, there was a presentation about testing strategy that you guys heard in the gating criteria. There is preliminary information or discussions that we're having about making the distinctions between the responsibilities of the Institutional Review Board and the Health Command operations as an entity responding to the public health emergency. So there are studies that are being, they've met this month, they started to operate again. They will meet in, I think, next week again. They're regularly meeting, starting to regularly meet and approve studies. So there are a couple of studies that I saw today when we talked with a researcher, and that have been approved. I think it's only about 3 possibly related to COVID-19. And so we will probably need to share that, but they are regularly meeting, starting to meet again and starting to approve studies. But our internal conversations with the Health Command Operations Center and UCG group, we would have to make a distinction on where we draw the line, or making sure that we have clear roles and responsibilities defined in where researchers do conduct research with COVID-19, and also how they're either translated into the emergency response in COVID-19. So those discussions haven't really been thoroughly discussed internally, but we're starting to begin having those conversations as you will see more information about antibody, antigen, and then also as we looked at finding or seeking ways to become a clinical vaccination, clinical site for vaccinations in some of these trials. I think Johns Hopkins has been involved in various studies that I'm aware of now regarding vaccines and whatnot, vaccine trials. But those are just being discussed right now. It still needs a lot more discussion internally with the Health Command Operations Center and the researchers that are involved, and then making clear responsibilities or how we make sure that we are staying in our lane, I guess. So that would be my response. Don't know if you have any other questions regarding my response. Thank you.
Thank you. Committee members, anything else? If not, we do have a motion and a second to adopt the report. If there's no other questions or comments, then the request for follow-up by Honorable Chair Amber Knuzbot Crotty. Shema, go ahead and bring some one-on-one conversation, but the committee will also do follow-up with Dr. Jill Jim regarding the initial issues you had brought up. With Ayla, Che, Mr. Mose, can you do the roll call vote?
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. Honorable Carl Russell Slater. Honorable Carl Russell Slater.
Delegate Slater, Green.
Honorable Carl
Delegate
Russell
Slater,
Slater,
Green.
Green. Honorable Pernell Halona.
Halona votes green. Thank you.
Honorable Halona votes green. Honorable Charlene So.
Green.
Honorable Charlene So votes green. Honorable Edison J. Winika.
Green.
Honorable Edison J. Winika votes green. Honorable Paul Begay Jr. Honorable Paul Begay Jr. Chair, we have a vote of 4 in favor, 0 opposed.
Thank you, Che. Let the record show a vote of 4 in favor, 0 opposed. The chair not voting. Now we go on to Otto. Dr. Jim, thank you for providing the verbal report. We appreciate it. We'll see how we go forward on getting the budget hearings scheduled. Thank you.
Mr. Chair?
Oh.
This is Beverly. Does Dr. Jim participate in the Sage Memorial Hospital report also?
Yes, you will. Yeah, once we get through the other reports, then we'll get to go back and do the Sage Memorial. Okay.
Chair. Chair So.
Yes.
Chair, this is Delegate Paul. Yes, I was voting green on the last voting, and somehow you couldn't hear me over there. So just to clarify, just to let you know.
Okay, we hadn't entertained any other motions, so the chair will rule that your vote will be counted. Mr. Mose, let the records reflect that Honorable Paul Begay has voted on accepting the NDOH report.
Right, sir. Got it.
Thank you.
So, let the record show a vote of 5 in favor, 0 opposed, and chair not voting. Thank you, Che. Now let's go to item 5C, report from Department of Personnel Management on protocols for staff returning to work. Dr. Ferfilia Fowler. Emma, you have the report.
Oh, yad ishiyaj, ado nashiyaj, ado shana, ado shje, kebeda kehit ko ihe nan hidishni do leto, ado sa koja hanata so kizido koja dal do sai, ihe do kuije ya kon. Nahahin do, it's good to hear your voice do na ihe. Kodai nida shit edge do hashil saga ekwa. Nahandad nishit KJK Tuisani. Nahedo Katon Tajon Dadlistole, Hatniniki, Jo A Kat Belaganik, Etro a reopening plan, Dekne, A Hashil Sagon Hitch Inshla, Ado do Art and then Hitch Inshla, that's not just the committee. Akwande, a Yisababa, a press release, a digital, Ado that's the Hash, Adoshi. Best bond or less a copa hashnaigi a reopening plan or yanigi hashin sago a yadi handad nishe sato yik ahos ido di konda nishiki a yat e honda and so ba ahayanigi jodi de kosnas ni hibits ba ahayad or less lido a abadas ado hashin sago an hit arbit in de bahi do has tan kesala on de canido dini hize do nichi tata de bali do hilla ta de kisiki eat hashin sako best on ado de belagana echo PPE de neni ni hin hata inishi ani ni hin hasala as the employer ako hashine la ad kwa Lewoshi tat atahos, Kalenda Slatahos, Kalenda Ida ya Hashin Sagodi Saladena Ani Lini contingency plan. Hata the dosli nihit on ni hatadilia and Hashin Sagodi Nihinat Lini Chief of Staff and Lini Bichwilia as executive branch division directors. Arona kunna AD May was your Kasedan Sata your Kasedan a reoccupancy plan by each division. So what we did is we put all that together. Hashim took a task force Ilya the reopening planning division directors and law. Though it's not just from our DPM or division of HR, Hashim took a D a leadership Dr. Jill Jim. Sato oyo ohni bahni yado hait a di de kosnas ni hane na petato na to a kuije e na kahi bikho khadelia to akodi nihichi ta nihini on ado nihina da petato ni ot ada bakha just some general guidelines to COVID auto policies and procedures dina anish Kuna has aniki hait ta any sona so that ye go betadil or that din chebech dil na halit hut nata anisto hatniki jo best practice stage neniki aja hanatelia aro hashin so go the flexible work schedule that they neto telecommuting days na aita hashin so go Nakanda Nishi Beda husband. These are administrative leave at the lot at March Ausanda the Nishi Hashin to go Kodopes Eastern Ni a training the Baido the Ani Kaditus at the Mobis Kanan Nahakao Sahajo and Tabedano T so Hajo Bes Eastern Ni Quasis kid is the Aro Hashin Sagodi need old Haje Aro chapters Judonana the query opening the quata inishi ki to is a bansala Aro gating criteria status schedule desne is a big aho Hala quadi atina niho yego nihita de honana zago nas not the dol kisa be ba hot it nihinat anin lini a huido lisa be ba hot it took at hashin zago kadatse tatin belos ka asi asadne zatin do be yaginat kito ako lato ni hishin to sato ta ko ebe na no tino do be ta hosian ta di no do ta no ako na ya atsan Aro Bikedo AGD COVID worksite safety guidelines or yes to Edo Hashin so executive branch to Sapahatelia. Goes into 18 pages. Edo Hashin so Isha to Nito Napetino Tito and within that one with the work safety guidelines we included some deadlines, but these deadlines some of them have passed. So Ashin Dati Division Directors and Lenny sa PPE they ni do sa atin sa tapapa ako ani kinakata inishi ben hihol nito be ba akwiliado le Ado hashin sagadi office reconfiguration dolye ndad nishakon na adi le has kankesala on that these kandos on that jikegi ito edo big hit Ado hashin sagadi curbside service la desne edo hashin saga program these la akwada Ado di nasko net nejidin nahas kegon dabadat all nini testing days nini ini ya hold net. The testing are mainly for potential exposures only days niya yise sato betol na koto ye na bahnesh jin ko santol kahne Ado di Allah na khadel nishin your front line days nini Aji gito edo khalet it kit the dot ito khela astato nini ati bondate belakanik eto testing strategies desne ako we have a team that we're working with and we want to know how many employees that we currently have that are on admin leave edo kohashin to I don't bahozan ako kwa ataga ho zangin danish I don't let the next highest number of our Navajo Nation employees in Tuba City area. Ako late out kit the hona that in nahakata that the no do ahosh such nahito kata the mobis kane de hashin sagadi talate not ani dan lini banana sla Ada the quick or nahito le ado the following week another group of people Ado hashin sagonan tine besintos tabedi no hut benat ni tinle and this is already available through our website Ado press release nihinat lini President or Vice President Ashi is electo lesto is kashi by yana is hito lesto etana to ahuna tanza Ado DCDJA chapter return to operations plan desne Edo aja hashin sagapanani Edo biga jo is ye da anni ayego is endo ni kaye da anni aja latobik enanas kitnle ako das ano hot ani an ben his na snet dole ado ani hashin sago has tuisani lini to kedan lini at the oyo ye bi na ga o atinta jo hashin sago ya ti sato beta nita akonde izel ej la ya ti da holno ado ko an hin hasla da holno jo ani dash kodo plan yike how are we utilizing our traditional practitioners nani shado ebitin shle halet ko ana sai leni gi chahato so the zinda do li jokodat da bitini lindo so that's in the works and I'm working closely with Dr. Jim to initiate some of those processes and procedures and a lot of the plan the worksite guidelines is with the guidance of the Health Command Center and then also the CDC guidelines. Akohot aya bana sisnet dole chedo na ihe anko ane daisano sai hashin zagoshi ani bana atikhetnte jo shatov khode na de shaton chote shnete de khit al that no be khosel ado benan hidnesh tinlido be khosel an ko when sago adnik acho be khasi ole I did forward to the committee the reopening plan and the COVID-19 worksite safety guidelines and for those delegates that are on the call I'm more than willing to send you a copy after this call and if you have any other questions I'm willing to provide a written response or either over the phone we also follow the guidelines of the public health orders. We also have the chapter reopening guidelines, so that's pretty much separate from our government lines and our government opening. So those are some of the things that I just want to bring to everybody's attention. And within our division, like Department of Personnel Management, within our programs, what I have my programs do is they each have what is called a reoccupancy plan. So that's what DPM does have, and it kind of goes in place, the guidance, the safety guidelines that we also have. We make sure that they abide by some of those, and I think our division is pretty much set with some of the PPEs that are in place. And then we also did our office reconfiguration systems. We are looking into like Shiprock area, Tuba City area, some of our on-site site location office. So so within, like, for example, for our division here, I think we're almost like 90% complete. I think we only got one program that has encountered some building exposure. So if we get a COVID employee, if we get an employee that tests positive, there's guidelines on steps on the worksite safety guidelines, what you do, who you report to, self-report. Those are some steps that we also take in the cleaning of the buildings. We got to do 213s with the Health Command Center. And then not only the isolation part, but the quarantine portion as well. So AD is reopening, and just for your understanding, let's say that everything's good, our numbers are still low, and the executive order gets lifted on August 16th. If it gets lifted as of August 17th, Monday, there's no executive order. That means there's no more special duty pay. So however, there's still a public health order. CHR dan le at the patients that you're not on trahi at the for those type of pay, but we need to make sure that we implement that on the new public health order. So bedeni nishwa sato benade listo what nana za ito ni no anle abetani so do aben so eya kodo bana hosnet dole so na hash che nskago an ashna che arosh but ebedak head hidini dole kun so go eya na big yasus kit dole ochata anako na ha. Hello? Oh. Hello, yat that's the that's
Dr. Fowler.
I can't hear you, Dr. Fowler.
We're all still here. Thank you.
Oh, okay. Yeah.
Hello, this is Beverly.
Oh, I'm sorry. This is Dr. Fowler. I just thought I lost you guys.
Hello.
Committee members are online.
Yeah, I got kicked off the call, but I'm back on. Can you hear me? Hello?
We hear you, Chair.
I can hear you.
Okay, good. Yeah, I got kicked off. I was basically, Tatsu, thank you for the report. Committee members, the chair is open for a motion and a second, and then after that we can do questions or comments.
Chair, I'll motion. This is Delegate So.
Okay, Shabiza Ushila, motion by Honorable Charlene So.
Second, Halona.
Second by Honorable Pernell Halona. Questions, comments? If there being none, then I would, in this whole process, what would be the role of NOSHA and OEH regarding workplace safety, and then the protocols on, let's say, employees that have compromising health conditions.
Yeah, Nadine Kitty. The NOSHA and the OEH, they do have proper protocols, and they do work closely with the Health Command Center. Aja Yisnadnish. Okwanda Apetse, the AD has Twisani to KJK and Lini Hate Ahoda, Bits Isa Bits Nahot, or AA, Yisipinat, Ani, Istayis Hazne, Dodo Art. And any has nesta all question nahot ignoda ado a reasonable accommodation des nefal e do alnego a hashin sagati izel in the bezel in the shinhullo a denko a not toss a yi ado a d qua ventilation that's the temperature that's the that's the not shown host sa whole sacho adult as no a not a health command center that qua not no it's a safety section jibit yahit auto safety section o benin dol no ADA OEH that's the bounce lachian satobedet or do that's the no shagi no Ki Bani Diego a arch a Sahiki Quasi the hotel or Sa Quest or Set the Tony a not so seek either lease auto ani Quagot Zalanio a safety snahadne auto safety a not so sedis in ani hotela Koti Quae Bash to Sena but a not ani Lenny. So we don't want to get a whole lot of medical information from the employee, but we make sure that our supervisors are aware that if an employee does have underlying health condition, that they're at least aware of it or know about it.
Well, I was on mute again. Honorable
Chairman, I have a question.
Yes, go ahead, Cecilia. Honorable So.
Yeah, one thing that I have a concern with the reopening and so forth. In the not an issue. And now I had a conversation with some tribal employees, and the basic thing I asked them
does your office have PPEs? Hollange, Ado da ate ita hadat ish in his kahatit akad petition. These are employees that are, I guess, deemed essential. This is in Tuba City. But then, obete the kodo hadit ada da ni kirmandi kaha. Oyo nahahon anahalo. Oyo in how come you guys are asking for these? Nah, nikit that ni. Nahadlo what akaho. Hatsi and pushing. So I really want to understand how the I guess the PPE dissemination is going on, and so I just bought my own mask, and that's what I use. I should use sanitizer. Only Walmart in a no. What and I said, can you do this for me to get it in writing? Can you get this thing down in writing? That first thing that person asks, I'm going to get in trouble. They're going to write me up, and they're going to want to do maybe try to find a way to let me go. Managers you can't done. It really makes me feel that there's this sense of tribal employees to speak out. So I see you the hosnita nahilan. I don't know about the hosnita. Maybe the tribal employees are told not to express their concerns. Or you based on that it it's just I'm trying to piece things together. We appropriated $4 million out of the first wave of the CARES Act that we funded. Why is it that some of these PPE has not gotten down to the program level? I'm going to make my way back to Cuba and try to get these statements in writing. And we're doing this thing really nice and when you get out to the field, and I'm trying to grasp my hands around it. And and then I guess if we could get an accounting from the donation, what programs received and how much and when. I know there's a listing of that such that was being discussed, but if some of the employees don't have that, PPE you could donate that that's just my regret for the day. It really concerns me, and we're going to be reopening soon. Thank you.
Oh, I think, Kitty, once you get that in writing, I can assist with that. There should be no form of retaliation from these managers, and I can assist with that on my end. And I will provide data because So once we get it, we want to distribute it right away. We have it well documented. And I think that's what we have to recommend our division directors to do. Don't not here.
So what Ayla, Kushila, committee members, any follow-up questions?
Chair, Che.
Oh, Che, Honorable Paul Begay.
Thank you, Chair. Thank you for the presentation. Dr. Fowler. Dr. Jill, I hope you're both still listening in. Dr. Jill, just for information. I don't know, so I had a couple envelopes I gave to Attorney General Doreen McPaul to deliver to you. It came from a community member. It is, but I did that, so I'm making sure that you got those envelopes.
Dr. Fowler, it's being addressed right now with Dr. Jim and myself. Thank you.
Yeah, thank you very much. Thank you very much.
Oh.
Sheila, what the? Hello. Oh, Sheila. Anonymity.
Sir, I have a quick question.
Go ahead, Honorable Halona.
Yes. Good afternoon, Dr. Fowler. Has there been any request for any early retirement from the Navajo Nation yet? As far as this COVID-19 is concerned, I know there was a lot of employees that were concerned about returning back to work. Has anybody done anything about requesting for any early retirement? And if there is, how many people are doing that request?
We do have quite a bit that are inquiring about early retirement. So what the administration is doing right now is we're at a discussion stages of putting together a 2020 Navajo Nation Enhanced Retirement Package. And what we're doing right now is we're gathering all the data and numbers and to focus on our objectives. And our objectives is pretty much to offer enhanced retirement benefit to employees that are most at risk. The enhanced retirement package is voluntary and reward eligible employees for their services and contribution to the nation. And then embracing technology by building on transparency, accountability. Those are some of the objectives, and our actuary will towers they down then he give us a couple of options, no alternatives. Is kits and we have to involve budget and finance. We have to involve RPAC. But before we do that, we're trying to get some data and numbers. I'll say that since March till now, I'd say we have over 11 that probably retired, and we still have more that are inquiring. And I think somehow they feel like there's going to be a package coming out, and they're going to wait to see what are some of the options. So we did have some that retired during the pandemic, And then we do have some that are possibly wanting to retire this month or the end of this, or at the end of next month, September. So our retirement office, which is under my division, there are now essentials. So we're looking at bringing them all back to help a lot of our people that are interested in retiring because they were non-essential from the beginning. Client lini yin da this kidi so once we get the final numbers, we have our meeting scheduled, our next meeting scheduled on August 21st, which is at 10 o'clock. It's by teleconference, but we did have a tentative one. If they're ready to share the numbers with us earlier, we're going to meet on the 19th of next week. So it is at discussion stage. We did have a little over 11 that possibly retired, but I can share some accurate numbers with you by email to this committee.
Oh, thank you. And just one other quick question would be, have you guys decided on the age limit for that, for the early retirement package?
We're looking at 60 at this time, 60 and above.
Okay. Thank you for that information. We appreciate the update, and I'll be looking forward to the next update. Thank you. Inshallah.
Yeah.
Committee members, any other follow-up questions? Colleagues on the call, follow-up questions? There being none, for Tree, I guess the main thing is because of retirement or even some of employees passing on, there are vacancies within critical areas. Just like in my district, I'm apprised that there's a senior citizen van driver that hasn't been advertised because the driver had retired in July. There was the passing of the senior center manager at Torreon. That particular position hasn't been advertised. So those are, and I'm sure there's other chapters in the same status, even where, let's say, a CHR has to be isolated and or in self-quarantine, and how do we provide that coverage? I know that that question should be to Dr. Jim, but I feel like that's also critical to how personnel management could proceed. Do some follow-up on it for us, and committee members and even the colleagues could also make email contact.
So Nishi, I have DPM on the line too, so Ms. Toddy, so we'll provide an update on all the positions that individuals that have retired, see why they're not being updated. We'll provide you an update in writing on that portion. Thank you.
Oh, Sheila. All right, committee members, if there's no other comments or questions, or even from the colleagues, Mr. Mose, roll call vote.
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. Honorable Carl Russell Slater. Honorable Carl Russell Slater.
Mr. Mose, we got a text from Honorable Slater that he was his call dropped, so he's trying to get back on.
Okay, all right, sir. Okay, Honorable Pernell Halona.
Hello, votes green. Thank you.
Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika. Honorable Edison J. Winika. We'll go back around again. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika. Honorable Edison J. Winika. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Chair, so far we have a vote of 2-0, well, unless others have been dropped to the line.
I think the others' calls have been dropped. Yep.
Chair, so Paul McKay. I did get kicked off the line, and that's why I had to call back again. So they might be having the same problem that I did. This is twice now that I got kicked off right before the voting. Thank you.
Okay. Che, I guess just report this to legislative communications. The committee is having problems with the teleconference. The other is just the fact that we might, early on there was other, the echo, and then also the interruption by some individuals making statements that, I guess, attacking the integrity of what we're doing. So let's report that and see what how we can best approach this and address to those folks. I think the more common name is somebody's trolling this teleconference. Okay, let's try again.
All right, sir. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika.
Chair, is this a vote for the meeting? I was off for a little while.
A vote on accept DPM report.
Okay, green.
Honorable Edison J. Winika votes green. Honorable Carl Russell Slater. Honorable Charlene So. Honorable Charlene So. Chair, so far a vote of 3 in favor, 0 opposed.
Thank you, Chase. I got a text from Audible Charlene so that she votes green. She got kicked off the line too.
Honorable Charlene So votes green. The only one we haven't heard from is Honorable Vice Chair Slater.
Okay. We'll proceed. Let the record show a vote of 4 in favor, 0 opposed, chair not voting. And we have a call from Honorable Vice Chair Slater, who's can't get back on the call.
Okay, sir.
Okay, thank you. So we'll move on to the item 5D, update report on domestic violence shelter contract from the Navajo Division of Social Services. Presenter would be Miss Deanna Neswit-Gishi and Navajo Division of Social Services staff. Ms. Neswit-Gishi, you have the floor.
Thank you. Good afternoon, Honorable Chairman So and members of the Health, Education, Human Services Committee. Thank you for the opportunity for allowing us to present an update on the domestic violence shelters. Just for clarification, Ms. Regina Yazzie, who's the department manager for the Department of Family Services, she's has been on a virtual summit on the State of Utah Court Improvement Project. She's been on today and she'll be on it tomorrow, so she will not be providing any remarks. But we did submit a report, a written report, to the Health, Education, Human Services Committee this morning. So I will be available for any further questions, as well as Ms. Brenda Sosi is on the line for any financial questions. And Mr. Chair, I'd like to turn over my time to Ms. Rosalind Begay, who is the policy legislative staff within our department, to provide information on the written report.
Yes, you may proceed.
Mr. Chair, can you hear me?
Yes.
Good afternoon, Yat Esh and Shanat I. Mr. Chair, Honorable
shelters that are still waiting for a paycheck? How far along are we on that? I must miss part of your conversation.
Mr. Chair, I would like to defer that question to Brenda Sosi, who's our principal accountant.
Hello, this is Brenda Sosi.
Oh, Miss Sosi, go ahead.
Oh, yeah, I just wanted to provide an update. Joe contract, it's still over at the controller's office. Those 5 contracts that Roslyn mentioned, they're still at the office of the controller waiting for a contract number. Once those contract numbers are issued, then I am working with the contractors now, the shelters, to get all the invoices in, and then yes, there will be a reimbursement all the way beginning October 1st. So, once the contract number is issued, then we can work with the invoices. So that's really at the tail end. For a still, we still need to obtain signatures and whatnot. So, it's going over to Department of Justice. Then it goes to the OPVP. The president will sign off on it, which is, he is already, the president already knows that the 2 or 1 of the contracts is going to be coming through. Just like Roberta's place, just respond. So, we're going to redistribute the funds among the other 5 contracts. So, thank you.
Another question, Chair?
Go ahead on your follow-up.
On the follow-up there, yes, thank you. You said until October 1st, they're going to get paid until then. I want to be correct on that. And then also, have you already started negotiations to renew some of those contracts, or are they just extended or rolled over? How is that being played out right now? Because I know some of those people that have not gotten paid from last year almost are not sure if they can be able to continue the service or not. So those are my 2 questions right there. Thank you very much. Chair.
Go ahead. Respond to Honorable Halona's question.
Okay, thank you. Thank you for the question, Delegate Halona. The reimbursement will begin October 1st, 2019 to current. So last year, October 1st, they will be reimbursed for those 5 contracts. Although the new request for proposal will be issued, and a multi-year, in 3 years, that's what the proposal is going to state, and that will be going out soon. So they'll respond to that. So we are ahead of schedule this year, and once those RFPs are issued and when they respond, although our goal is to begin these contracts October 1st, based on the ACF AI award in Hitilia, will be able to start begin the contract October 1st. So we are ahead of schedule. Mr. Chair? I forgot to mention was the award. This year, the award wasn't awarded until February. For this year, based on how that
So eben nachit go the paperwork gates king ho she no tahtole. Although these subcontractors are still ndabadikit le contracts I mean RFP me te leho ha ela so what other funding source do you have that no call they reveal those information to us. So these contracts the shelters based on the they're being funded from other resources so thank you.
Committee members, any follow-up questions? I guess the one of the ones you said there was no response from the shelter that's operating out of grants. Were they given certified letter to notify that they needed these additional requirements on insurance? And then I guess really that's the part. And then did they give a official response that they didn't want to pursue this the contract that had been previously awarded?
Okay, Mr. Chair
and
the committee members, I am working with the contractor, Ellis's place from grants. So I am working with them, and today I was asking them, we need information from them. So they report to their board of directors as well. So so today I asked her again, see if what the decision was from their board of directors. Respond later. We are still working with them, and let's see what the reply is. So, I mean, this request, we did give them a deadline, July 6th. Reply no other than nothing. So although I continually started to work with them very closely, those contacts I've been making with them. Although so today Nana, and she emailed me last week in that Friday. I will give you a definite answer. She's seen that she did not reply later. So so moving forward, she certified letter that just today they'll respond law.
This conference has reached its maximum duration and will end in 1 minute.
Are they not let's talk on the or email there. So phone messages and not so the communication is kind of difficult. So thank you.
Okay, committee members, you heard the little whisper on the call that the teleconference was going to end in a minute. So when that happens, and everybody else that's on the line, redial into the same number. Because with this service that we have, I think that it goes in 4-hour blocks. So that would be the consideration. Even at NABI, even at council, we run into that same aspect, of course.
Are we going to stay caught up on these payments after we get started? How are we going to get that resolved? That's my question. Thank you, Chair.
Mr. Chair, this is Deanna Nesodishi. May I do a response to honorable delegates' questions?
Yes, before you respond, let the record show that Honorable Carl Slater's back on the call. Thank you, Cecilia, for being persistent to get back on the call. Miss Deanna Neswit-Gishi.
Thank you, Mr. Chair, and thank you, Honorable Delegate Halona, for the questions raised regarding moving forward. Insurance requirement. That is where we're applying with the process to ensure with Navajo risk management that those requirements are always there. And so what was not abided by prior contracts is have these the request for proposals reviewed by Navajo risk management, and so that's a requirement that was not done in prior years. So we will proceed. We do have a draft RFP, and we're working on to make sure that we do the proper management look at the RFP prior to it going to Department of Justice for their review. So we are in process. We have meetings on this to make sure that we are going to have it timely processed. And regarding the payments, the prior contracts were listing to where we're paying salaries. Some of the positions were at 50%. Again, as Ms. Sosi had stated earlier, that the facilities, the contractors, they have other funding sources as well. And so as far as services that are provided, the team members, I'm not sure if you're aware that the other facilities that we have, such as nursing homes, children care homes, there's a daily rate, and so an invoice is submitted monthly from the vendors on a daily rate, and that's how the new RFP will be submitted to the domestic violence shelters. It will be on a daily rate where they would be using the funds. However, the vendors choose to do, whether it's to pay salary or their utilities or whatnot. And so that's going to be in the new RFP, and that's what we're working on right now. So we are doing better regarding the invoices that are coming in from the nursing homes, the other shelters for children's care. We've had to implement some changes to ensure that when the month is over from any of these other vendors, that by 5 days, we need to make sure that we're reaching out to make payments timely. So those are some internal processes that we've had to put in place to make sure that we don't have practices that are substandard. So those are some areas that we are moving forward with. So, you know, we're welcome to provide any other reports as requested. Thank you.
Thank you, Deanna. Just a quick follow-up on a statement that, you know, those shelters are getting paid from other vendors. I'm pretty sure they're turning in their paperwork on time and getting paid on time. I just don't want the nation to be left out on not being able to do their part and to pay these bills quickly. So we shouldn't be depending on other vendors that they're being paid for to keep them running. Of course, you know, it is a business, and like I said, when I get to do a job, I like to get paid right away when the job is completed, especially if it's on a contract. So I just wanted to make that statement that I know you have had several difficulties in, of course, the insurance and change of management, change of supervisors, stuff like that. So moving forward, please just just know that we would like to be on the same page as everybody else that gets paid with the shelters when they do make their invoices. I just wanted to make that statement. Thank you. Yeah.
Go ahead.
That's the end of my comments, Chair.
Okay. Committee members, any other questions?
This is Delegate Slater.
Oh, Cecilia, Honorable Vice Chair Slater, go ahead.
Thank you, and I apologize, Dr. Nezergisha, for probably missing information that I'll be requesting in these questions. But I think that the issues of communication, goodwill, and good faith really haven't been addressed, and that is from speaking with the shelters themselves, speaking with staff in the program, in the Division of Social Services. It just seems like there is a complete loss of morale and faith in the division. And I really want to hear what the plans are to restore that morale and get the division functioning at that high level where external entities or subrecipients feel that they are a part of a team, that they are delivering services on behalf of the nation in good faith, with a good faith partner, and that there's a positive path forward. I don't think we've ever heard any sort of expression from the division saying, yeah, we messed up, we didn't communicate appropriately. We were going to enforce things in this contract that we hadn't been and had failed to do, right? That wasn't the programs, that was failure of oversight. And in doing so, that communication needs to be there and needs to be expressed to the divisions in a timely manner. It's not enough to just fall back on policy and say that, oh, these were deficient in the past and we're fixing them now, and really insinuate that either it was the shelter's fault or someone else's fault, when really it's oversight's responsibility and the grantor to establish that consistent communication so everyone knows what they're supposed to be replying to and they're doing everything in a timely fashion. And I think that, the positions that have been established consistently were, just abide by what we're saying and we'll get the contract out, when it gets out. And there was no expression of remorse or of, again, like humility. And I think that is what could go so far to repairing this relationship. And absent that, I don't really see how the relationship can be repaired, because the same things are being said over and over again. So I don't have the solution here. The solution has to come from the executive branch, and the committee doesn't have the solution here. We've tried to ask how we could legislate things so that we could help with some of the insurance requirements or things like that in terms of temporary waivers or ways of amending our procurement code to make up for some of the issues. And that was us coming to the program and saying, hey, we'll help you out. Like, we know how these things can essentially languish within a program that isn't being effective for a long period of time, that isn't following the rules as they should be followed. And I respect the division's prerogative in trying to address those issues. But the vision that I think the committee has for government and for how we treat especially programs under social services that impact human life and are really delicate is from that place of and understanding our obligations as an actor in each one of these situations. Yes, the shelters have responsibilities, but the division also has responsibilities. And when we err, we have to own up to it and express how we're going to do things differently in the future. But those commitments and how things will be done differently in the future are hollow until there's real action to repair the relationship and the communication. And I really ask that the division continue or reestablish those Zoom calls with the programs, with the shelters. And I'm deeply concerned getting reports about staff doing work outside of their grant responsibilities. And I think that, we need a commitment today from you as the division director that all staff are working within their grant and contractual responsibilities from their funding sources. But, either people are lying to us from within the program, which I find hard to believe, because it's too easy to disprove them if they're lying, and especially with all the copious documentation and expressions of how they're being assigned to do work that is outside of their funding source. It's just difficult. It's difficult as leadership. It's difficult as a shelter. It's difficult as a staff member. And I don't know how we can institute that culture shift within the program. I think that the dynamic is such that the trust has been eroded beyond repair. I don't think there's anyone here who wants things to continue as is, with program management leadership, with division director leadership. It seems to be pretty adamant across the board, and with no recognition of that, coming from these reports, and just saying, we're going to plug along and charge along as always, with this new path. I don't think we're going to really get buy-in and have a successful program in the shelters and strengthening families and family violence prevention. We need that buy-in. We're all a part of a team here, and we all need to support each other. But I'm expressing my frustration right now, as someone who cares deeply about the shelters, who cares deeply about the staff, who cares deeply, most importantly, about the clients, our citizens. And I think it's not a very satisfactory answer as a leader when you go back and say, look, this is the delivery of a program under the executive administration, under the executive branch. We cannot intervene in the direct details. We can perform oversight and receive as much information as possible, but we can't micromanage. And when there's a preponderance of evidence pointing to eroding the trust, diminishing the relationships, diminishing the communication, I just don't see how we can move forward in a good way without some really big disruptive realignment. And that's the sort of bold action that I'm asking from you, Division Director Neswigishi. You're not going to get the buy-in from anyone at this point without that sort of big, decisive realignment and action. And it could be something as simple as communicating that we're going to talk every single week. I'm going to set aside an hour, because due to that lack of communication over months, inconsistent communication, things that were just plainly wrong in terms of the RFP and the contracting process and what commitments were made by different program managers or oversight. There hasn't been enough to reestablish that. And that time that was lost needs to be made up. And that's how you can rebuild that trust. But without that, if things keep going as is, we're going to have to get a lot more detailed, I think, from the committee level in terms of requesting information. We get these reports, but they're very sterile, and some of the details are lacking, especially when we ask specifics. And I think that the committee will be submitting a letter to the division, and if it's not the committee, then it might just be myself requesting some more information and some assurances that money is being used appropriately, and that there's a strategy on how to repair these relationships. So, thank you, Chair.
Thank you, Cecilia, Honorable Slater. Committee members, any other follow-up questions and statements? I realized that the call was for the domestic violence shelter contracts, but we are keenly aware that the division also operates 2 shelters, and if you could provide additional information on those 2 Navajo Nation operated domestic violence shelters, that would be appropriate at this point.
Thank you, Mr. Chair. This is Deanna. Nestor can do a response for an update on the other 2 shelters?
Yes, go ahead.
Okay, thank you, Honorable Chair, members of the Health, Education, Human Services Committee. The Division of Social Services has a domestic violence shelter in Shiprock, and so that is fully functioning. They're receiving families within the shelter. So they have been in full operation since I came on to my position in April 2019. So they're continuing to operate. The other shelter is the Gentle Iron Hawk Shelter, which is in Blanding, Utah. From my understanding, that was a shelter given to the Navajo Nation a few years ago, and so we're working with the principal victim witness advocate, as well as the department manager, Ms. Regina Yazzie, to get that open. And so we are looking at a target date of November 2020 to have that open. It is a needed service within the community up in northern Arizona, as well as southern Utah. So we are working on that. We did get a call from Utah Navajo Health System, which is a healthcare system up towards Monument Valley, Montezuma Creek, and so a meeting is scheduled to occur tomorrow. The individual, Michael Jensen, I believe, was the person that contacted us. And so we will proceed to work with Utah Navajo Health System to see how we can proceed so that the services are provided in the shelter. Thank you, Mr. Chair.
Could basically provide something in writing regarding that particular new development. They are a 638 authorized healthcare entity. So again, basically would seem like there'd be a contract process also. Committee members?
Chair, can I ask a couple questions? Dr. Slater.
Go ahead, Cecilia, Honorable Slater.
Should I? Division Director Nezugishi, we've heard that it seems like the division is hemorrhaging staff right now, and I'd like to know in the past 2 months how many staff have left the division and what the strategy is for strengthening the division. My concern is that there seems to be a culture that people don't believe that they can buy into. And a lot of it, when you talk with them, either people have left or people who are still there who can't leave because they rely on this job to provide for their family. They're facing bullying and intimidation, and a lot of the things that they share with us, we can't communicate, honestly with the program because there's a history of reprisal and bullying and intimidation that is documented within certain programs or within the whole division. And that's been presented to us before. We've received a lot of testimony on it. The testimony's been consistent, and certain actors have been identified, definitely. So what is the plan to get staff in place that have left and restore a hospitable working environment where people feel safe and that they can execute their duties freely?
Ms. Leslie Gishy?
Thank you, Mr. Chairman So, as well as, excuse me, Honorable Slater, for your question. I do not have the exact number of how many staff have left due to transfer, resignation, or retirement. I don't have the information prepared right now. Within my office, there has been one retirement, but no staff leaving the executive office. Now, regarding the statement of bullying, I only have primary communication with the 6 DSS managers as well as the executive office. So I can reach out to the managers for their comment in this area, and that how many staff have been departed from their various departments or programs, and then a plan that they may have to restore hospitable work environments. So I can do follow-up on that, Honorable Slater, because I do not have that information. Thank you, Mr. Chair.
Who is the manager of the Utah facility, and where are they working?
Honorable Slater, we do not have a particular office in Utah. We do have the Gentle Ironhawk shelter, and there is one principal victim witness advocate who the position job description does indicate that they are a supervisor, and so there's other staff within the office.
So where is that person working?
The individual is in between blending and as well as assisting in the Shiprock domestic violence shelter as well.
So what's their work site?
Honorable Slater, I believe it is in blending. I don't have the specifics. These positions are under the Department of Family Services, so I would have to get that information, and I can provide a response.
Okay. It's my understanding that there aren't any services in Blanding right now, and that it's been relocated to Shiprock, and that maintenance staff, IT people have left the division that were supposed to be supporting that site, including HR. So I feel very strongly that, if we make these investments, we need to be able to support them over the long term and figure out how they can be durable and sustainable. And it seems like the Navajo Nation facilities are getting neglected to a certain extent. And I don't know, it's like the nation steps in and makes a commitment to a community or to our Utah and Navajo relatives, and it's with the impression that we're going to come in and service, our people, our clients, our citizens. And instead, it seems like we're taking steps back instead of steps forward. So I think, it's really important for us to get a plan together on how we're going to get all of these positions filled and make sure that everyone who's delivering these services feels like there's a cogent and coherent plan on moving forward and that they're a part of it and that they're supported. And then I'd asked about doing work outside of grant contracts. Can you assure to the committee right now that all of your staff are only performing work within the confines of their contract and grant responsibilities?
Neswood Gishi.
Honorable Chair and Honorable Slater, I'm not really certain how to respond. I'm not sure what specific questions. If so, if we could go into an executive session, if it's going to be talking specifically about personnel, because this is an open forum. If you'd like to have more information, that would be my request, Mr. Chair.
I don't believe that's necessary. We just want a commitment or a statement from you as the division director stating that none of your staff are doing work outside of their contractual responsibilities under the grants that fund their positions.
Thank you for the clarification, Honorable Slater. I will have to go through all of the department managers to get that information. I do not directly supervise the line staff, so I will get that information. Thank you.
Sure, this is Delegate Slater. I think, from the committee's perspective, that's not a satisfactory answer. We need to have that assurance from the chief executive of each of the branch or divisions over which, we perform our oversight duties. And they should feel confident in their staff, in their organizational structure, and in their department management and program management that they can affirmatively answer that question and say, we are 100% above board and our structure is set up so that even if there was an indiscretion and someone accidentally, was copying papers for someone else or had to do some work, that it was addressed, the hours were logged back to general funds or something to that effect, et cetera. And I just need to make that comment because, I want all of our programs that we work with to think of these next couple of years with HES as a partnership to build, improve, and level up. If we don't have that as our goal, then we're going to keep treading water. And if we're treading water, then we're going to keep floating out farther to sea instead of actually helping our people. So, if we don't have that trust where we know that our managers are overseeing their staff responsibly, we know that staff know that there are clear instructions on what their responsibilities are and that there are repercussions if they do not follow the rules. That's of concern to me. So, thank you, Chair.
Thank you, Vice Chair Slater. Yes, this issue just remains out on needs attention. I guess it's the main thing that the committee has been focused on, and or an employee. In previous reports, the individual that's heading the Iron Hawk program, previously it was reported that they're at Shiprock 2 to 3 days out of the week, and then the rest of the time back in Utah. The other thing we've received report on is the reason that program's really not going forward is because the facility hasn't been cleared for occupancy. And when will those items be addressed? And right now, that the whole program seems to be just out there. The attention, and we hear reports from the epicenter, from Health Command, that there's an increase in domestic violence. But with this Division of Social Services, it doesn't seem like there is proper and due attention to address that particular aspect. And how do we best correct it? And it's very disappointing that a division director doesn't have that proper information to be able to respond to the oversight committee. So as long as those corrections aren't being made, then this particular item will remain as part of the HES agenda going forward. It's beyond a point where we have to say these things on public, in the public forum. Committee members, do you have any other questions? If not, we have a motion and a second to accept the report.
Chair, this is Emily Ellison. By chance, could I make a couple of statements?
Miss Ellison, you may proceed.
Just one of the things that I wanted to talk about regarding the FIPSA funds and its uses is as DV shelters, we are not allowed to hire people who have a criminal background involving violence. And I'm not sure if this is something that the Social Services Division has in their policies or even enforces. And that goes back to that concept of bullying and intimidation. Collectively, as DV shelters who are subgrantees of these FIPSA funds through the Social Services Division, we have a concern about potential retaliation for bringing to light the atrocious, terrible administration of these federal funds. With the RFP coming out here soon, we're a little concerned that our individual agencies will be singled out, and we're hoping that won't be the case. We're simply advocating for our program. And so that's what I wanted to state.
Thank you, Ms. Ellison. Committee members, there's no other statements or questions to the division. Mr. Mose, roll call vote, please, on the motion to accept the report.
Mr. Chair, this is Beverly. Mr. Chair?
Go ahead.
I'm wondering the status of the budget exhibits for Division of Social Services. They're due by tomorrow, and I have no response from the Division of Social Services, Mr. Chair. they need to be attached to the legislation, the budget legislation.
Okay, Ms. Deanna Neswit Ishi, in regard to legislative advisor's comment.
Mr. Chair, this is Brenda Sosi. In response to Beverly's comment, I do have the Form 6, which is reported on that exhibit forms you guys have. That information is still being verified by OMB. So once I get a response, then I can submit the forms or the exhibit forms to you. I should get that to you by tomorrow morning.
Okay.
Thank you.
I'll take care of it. That's all I can do.
Okay, committee members, with that response, then the roll call vote.
All right, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr.
Probably vote red.
Honorable Paul Begay Jr. votes red. Honorable Carl Russell Slater.
Delegate Slater votes red for survivors and for our staff.
Honorable Carl Russell Slater votes red. Honorable Pernell Halona. Say again, sir. Honorable Halona.
Voter votes red.
Honorable Pernell Halona votes red. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika.
Red.
Honorable Edison J. Winika votes red. Last call for Honorable Charlene So.
Okay.
Chair, we have a vote of 0 favor and 4 opposed.
Che, Mr. Mose, I got a text from Honorable Charlene, so she's been kicked off the call, but she texted and said she's voting red.
Okay, sir, so the vote is 0 in favor and 5 opposed. Chair not voting.
All right, thank you. With a vote of 5 in favor, 0 opposed, or excuse me, 0 in favor and 5 opposed, and the chair not voting. We go on to
Alpratero.
We go on to update report on standing committee budget from Shajah, Mr. Tom Platero, Office of Legislative Services. Item 5E. Shajah?
Yes, sir. Mr. Chair, members of the committee, I sent an email last night at 6:21 p.m. that went to all 24 delegates and also Mr. Mose and Beverly that has all of the information. If everybody could pull that up, I'll go through the presentation from that email. So if you look at the first file that says the 4-year budget review, if you look at the health and education on 10/10/30, is your account number in your Health Education Human Services Committee. In fiscal year 2010, your budget was $124,992. You spent $126,549.58. In 2018, you had $130,278. You spent $107,139 and we had a balance of $23,177.61. In fiscal year 19, you had $132,815 budget. You spent $56,057.14 for a balance of $76,757.86. In fiscal year 2020, you got $133,452,000. You expended $42,844.23. You have an opening balance as of July 30th of $90,607.77. So what I did is I took the average expenditure out of the 4 years, the 126,000, the 107,000, 56,000, 42,000, and came up with an average expenditure of $83,137.84. So in the general fund allocation, I went on ahead and allocated $64,327. Now, if you'll go back to the email, the second one over that says the legislative branch fiscal year 2021 budget reconciliation. If you scroll down to 10/10/30 on line 24, your allocation is $83,137.84. There'll be a carryover request of $30,000. So if you add the $83,000 with the $30,000, your actual budget will then be $113,137.84. So what'll happen is in the budget process, we'll put in the carryover request because you're not going to be able to spend all of your money this year. So your actual budget will be $113,000. So what'll happen is you'll get the initial $83,000, and then your carryover request, once that hits, that'll go before the committee. The committee will decide where to allocate it within those budgets. So if you go back to the email, open up the file that says Health, Education, Human Services Committee, this is the detailed budget form that's going to be submitted in the budget packet. So if you look at it, that's the 64 numbers aren't matching. I need to make a correction, Mr. Chair. Your budget will be $94,327. And the page one, and then when you go to the next page, your Form 2 is there. Pretty much the same thing where you'll be working on veterans policies, regular special meetings of the committee. This is what you'll be assessed on, legislation to amend the code, advocate on health, education, social services issues, and advocate at the state and government level. So all of those are pretty much staying the same. So for your initial allocation, we're putting in $3,000 for special meetings, $1,200 committee meetings, and $2,000 for $11,200 with a fringe benefit of $1,127. We then go into your travel, off-reservation vehicle rental for $1,000, personal travel at that $34,914, $8,000 for per diem meals, $9,000 for lodging, $16,000 for mileage, other travel expenses, $1,500. Airfare will then be $4,000. Then we go into supplies, office supplies. We're putting in $2,000. Operating supplies, $1,000. Building and space, $1,000. Equipment and supplies, $1,000. And then your special transactions for programs will be $40,000. Everything is in level of detail 6. When you look at the column C and D, so for promotional items, it's $1,000. Gifts and awards, $1,000. Catering, $1,500. Refreshments, $500. Then for training and professional duties, we put in $3,000. And then the insurance premiums on the for the workers' comp, off the original $11,200 will be $86. So your total budget for the first phase of it will then be the $64,327. So if you go back to it, and the first one, your expenditures, is about this. It's within range. it's about 7,000 over what you normally spend. Mr. Chair.
Thank you, Mr. Platero. Committee members, what are your thoughts? Now, this is the budget that would be presented to go into 2021.
Quick question,
Committee member. Honorable Halona, go ahead.
Yeah, so Tom, this budget this year, the numbers are lower, and you're projecting the same amount for next year? Is that what I see?
Mr. Chair, members of the committee, I basically based it off of what your spending pattern has been for the 4 years. There will also be usually there's a request in that goes with the budget process of how much the legislative branch carryover last year was about 1.5 million. So that will be at speaker's discretion if they want to allocate some of that out. And just so you're aware of it, I just had the budget information updated, and it came to me about 30 minutes ago. So when we look at health education, your expenditure for right now is you have 138,000. You spent $38,316.77 for 27.42% of your budget, and you have an outstanding encumbrance of $4,853.73. So your actual available balance as of right now for fiscal year 2020 is $95,405.50. You have available 69.08% of your budget that was allocated for this year. So your expenditures are way, way down. In comparison to what your budget is, you've only spent 30.91% of your entire allocation for the last fiscal year.
Okay, so that's basically because we haven't been going anywhere, doing a lot of travel over this last 4 months.
No, nothing. It's been down. Most of what my recommendation for next year is that whoever your legislative financial manager is, that every month or so, once a month, that you would have them come in and go over the budget so that the committee really understands what they have, so they can spend it. Really advise you on how to make sure that you get the money. The advice are
short next year.
The advisors really aren't budget people. They can see a report thing, but every month I generate one of these and I email it to all the delegates, and somehow we need to get in the habit of saying, okay, we're at the first quarter, we should be spending around 25%. What do we need to do to stay within our percentage? So it's really guiding you through the process. And so there's a position that's at Speaker's office that's supposed to be doing that, which is the legislative financial manager. Just so you're aware, all of the expenditures that are here are handled through Speaker's office. Office of Legislative Services, I'm not a signature onto this account. So if you need me to say I want to get a notebook, I have to submit the request to Speaker's office. Speaker's office then processes it. They get the item, they give me the item, and then I get it to you. Whereas working with Speaker's shop and the finance staff that are over there, you should be able to submit your request to them, have them process it, and give it to you. So in the 8 years that I've been here, all of the committee budgets have always been under office of the Speaker. So right now, I'm helping the Speaker's office do the 2021 budget. And so if you look at the the legislative branch between the council, the standing committee, and the Navajo Hopi Land Commission has unexpended $1.4 million. That's a large sum to have unexpended. Out of that 1.4, you could probably do a breakdown. All of the stuff that's under stipends and fringe benefits, all of that just goes back into the personnel lapse fund. Then the balance and the operating portion of it that you don't spend could either be carried over. You can only carry over, as far as I know, the operating portion of it. There's the personnel portion or the stipend portion of it goes back into the personnel lapse fund. So the operating portion of it, you could either carry it over. If you don't carry it over, then that's what contributes to the UUSD balance. Mr. Chair.
Thank you, Mr. Platero. The main question before the committee is, shall we go with the budget that Mr. Platero has presented? Again, that figure is 100 and what thousand?
It'll be 94,000, 30,000 carryover.
Okay. Committee members.
Okay, let me go back to that screen. Hold on. So
Chair, can I make a comment?
Go ahead, Mr. Honorable Slater.
Thank you. Ms. Martinez, I'm struggling to find the email that you sent out. And I was just wondering if you could tell me the title of it so I can find it in my inbox. And then the second part of my comment is, I think that we as a committee, considering how much money we've saved this year through these telecommunication processes, should consider implementing a part of that into fiscal year 21. And we don't need to make a commitment to that right now. But if we're still able to perform certain aspects of our oversight duties through this manner, or through a manner that saves the nation money, then that's money that can go to our shelters or go to improving roads and go to things that provide direct services. So I think if we can all just keep that mindful about how we want to operate in fiscal year 21, I think there are a tremendous number of drawbacks to how we're operating, and they're very infuriating at times. But there might be a way, as COVID subsides and we go back to normalcy, that the committee and the legislative branch could integrate some cost-cutting measures, and maybe that is making some upfront capital investments into certain types of telecommunications infrastructure. And with the savings that we might have from this year, that's something that the Speaker's office should consider. So if Mr. Platero and Ms. Martinez, as you continue through your work and you hear us, if that's something you can communicate to the Speaker's office to kind of conceptualize what a legislative branch, 3.0 would be. Let's say 2.0 is past the 2000s, and now we're moving into the 2020s. Yeah.
Mr. Slater, Delegate Slater, it's under Tom Platero, Tuesday, I believe 6:21 p.m. The email.
Mr. Chair.
Go ahead.
What will happen is these are just proposed budgets. When we get to the budget hearing process, the recommendation that Delegate Slater provided, that would be up to council at that point if they want to move money around. and create some sort of fund to do that. Right now, we're just, these are preliminary budgets. When we go into budget hearing and you want to move stuff around, it is certainly going to be your discretion. And when we get to that process, we'll go on. I'm working with all of the departments within the legislative branch. We have 4 more budgets to complete. And my goal is to try to get those budgets to you all early so that you can review the budgets for the entire legislative branch in detail. These ones are just allocations. We're very early in the budget planning process. So once we get all of the budgets completed, we have the form. There's 3 attachments to the first recommendation. Okay, let me backtrack. The fiscal year annual appropriation of general funds is actually a 2-tier process. The first tier is where oversight committees take a look at the budget. Then what they do is they recommend a budget for their oversight to Budget and Finance. Then Budget and Finance will then do a legislation where all of the budgets are done. Then Budget and Finance does a recommendation to the council, so that 2 passes. Then after Budget and Finance, that's when the entire comprehensive budget comes before the council. So there's multiple times that delegates, or 3 times opportunities potentially where delegates could move funds around. So this is very early in the whole budget development process. But the first one will be when we have Navajo committee budget hearing. That's when you'll be able to get input. And then you'll get input again when you have the final comprehensive budget. So in the first phase of it, for the legislative branch, it's just the budget that you have oversight over. Then Budget and Finance comes up with the recommendation. Your second take on it is going to be where you actually take a look at the whole budget for the whole Navajo Nation. Mr. Chair.
Okay, committee members, this is just an update, and really going forward at some point in time, we have to make a decision on what will be included in the legislative branch budget for HES, Health, Education, Human Services Committee. So with that, committee members, again, it says presented as the 4-year average, as well as some ability to consider and ponder next year's consider it what we'll include in the budget for 2021. Committee members, Mr. Platero, is that basically what the aspect of this report?
Yes, Mr. Chair. I just want to make you aware of what the proposed budget, how the process that we use to come up with the allocations this year. I'm trying to work on another spreadsheet. The total amount that was allocated for legislative branch this year has dropped a little, and I'm trying to get all of those numbers together. When we get to when we get to the budget hearings for Navajo, I should have all of those numbers ready. The other part that you have to realize is that the COLA that was given, do you remember when fiscal year 2020 budget was being going through the process, there was on page 3 or something of that, you gave a COLA adjustment to Navajo Nation employees. The first year is covered by what they call the personnel lapse fund. Basically, it's just a fancy word to say that personnel will adjust it at the end of the year. This is the second year of the COLA. What happens then is during the second year of the COLA, programs historically would have to take money from their operating budget and put it into their personnel. When we were calculating the personnel or the allocation budget, we actually separated out what the cost of personnel would be, and then did an allocation in two phases. So we allocated for the money for all the personnel costs, and then we allocated money for operating. So all of those costs added up, and I'll have that money or that dollar amount available when we get to Navigated Committee. So you actually had to move money around to cover the cost of the COLA adjustment when the fiscal year 2020 budget was approved. And I'm trying to make it not too complicated. You know, when I hear finance give a report, sometimes they use all these different terms. I try to do spreadsheets that are just on one page so that we can all understand it. I'm not an accountant, but I know how to do the tribal budget. And so that's where I'm trying to provide as much help and as much information to the delegates as I can. That's why when I sent out this information, I sent the information for all of the standing committees and council and Navajo Hopi Land Commission, so that delegates could get into the process of reading budgets and understanding how all of that will come, so that it'll help you when you start going into oversight with your committees. Mr. Chair.
Sheila. Oh, Shazab, Mr. Patero. Ms. Martinez. Do we have a motion and a second established?
Not for this report, not yet.
Committee members. Motion to accept report.
Second that motion.
Was that Che Paul Begay that motion to accept the report?
Yes, it was, Chair.
Okay. Halona's just broadcasting over you. That's how come I couldn't. Okay, and Halona will be second on that motion.
Oh.
Further question, discussion? If not, Mr. Mose, Che, roll call vote, please.
All right, sir. Honorable Paul Begay Jr.
Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Second Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Honorable votes green.
Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika.
Green.
Honorable Edison J. Winika votes green. Honorable Charlene So. Chair, you have a vote of 4 in favor, 0 opposed.
Okay. Che, Honorable Charlene So texts that she was lost all cell coverage, so she's driving to a hill above Sweetwater chapter to get better coverage. So,
Right, sir.
So the vote is 4 in favor, 0 opposed. The chair not voting. So we go to item 5F, report from Sage Memorial Hospital on 93-638 reauthorization. We have CEO Christy L. Maligi, and let's also have Dr. Jill Jim be part of this report.
Thank you, and good afternoon. Thank you for the opportunity to report to the HESI Committee. Good afternoon, Honorable Chairman So and honorable members of the committee. I really appreciate this opportunity. The intent really was not so much to provide a report, although I have a lot to speak about, but more so to request the guidance and hopefully kind of step-by-step of what needs to be document-wise and I guess process-wise, what needs to be submitted for SAGE to request its reauthorization of its tribal designation. So with that, I can kind of tell you a little bit about what SAGE has going on and what our plans for the future are, if the committee members would like to hear that report. So the reason that SAGE is will be submitting its request for the extension or reauthorization of its tribal designation. As you may or may not know, all of the 638s were on one resolution as a group back in 2005, and they all received their tribal designation at that same time, and they all expired, or they will expire September 30th of 2020. But as you well probably already know, all of the other 638s, I believe, have come before the committee and have requested reauthorization of each of them separately. So that's what SAGE is embarking on. We had started this process prior to the COVID-19 pandemic, and then, you know, everything kind of got tabled as we all scrambled to try to get ahead of this pandemic that's going on. So one of the major reasons that we need to request the reauthorization that will expire on September 30th is because we have submitted our proposal to IHS for our self-determination contract for our funding. That also expires on the 30th of September if we don't renew that and, you know, go into negotiations with them for our next 3-year contract for funding. We are also at the final stages of developing this new hospital. So we will be breaking ground the first week in September on the construction of a new 40-bed hospital, replacement hospital in Ganado, a new medical offices building, and additional staff housing. So before we, you know, get into signing the general contractor's contract with them, there are a few things that we need to set in place, and one of them is, you know, we need to secure our financing. We're looking at municipal bond financing, and they will require for SAGE to have, you know, a multi-year tribal designation in order to get that funding. So that is, you know, essentially why we've come before the committee today. And so far, we have received 7 out of 7 of the 8 chapter resolutions of support. We have 8 total in our service area, so we've received 7. We're hoping to have our 8th by next week. We do have our annual audit for 2019 and our 2018-990. So, you know, I know that, you know, we'll probably need to put a packet together that includes all of that, our quality of care and census report. And if there's anything else, you know, we would just be grateful to hear from the committee and Dr. Jim, any additional information that you would like to receive so that we can get all of that put into a packet and then come before the committee to request that reauthorization. And I'd be happy to answer any questions.
Thank you, Ms. El Miligi. Dr. Jill Jim, are you on the call? Committee member, Dr. Jill Jim, are you on the call? Committee members, do you have any questions for Sage Memorial CEO?
Yes, Helena.
Go ahead, Honorable Helena.
Good afternoon, Ms. MED. So I know back in March was a great time to start the process to get recertified, because right now we're pushing it to the end. We'll have to get a legislation started. I'll need to get the information from you, the reservations and the different requests, so we can get your 638 approval done again. And again, it's going to have to go through several committees. We'll probably need to get that started soon. Chair, I guess I can, when I go in this afternoon to do the legislation for the school, I guess I can get started with the one for Sage Memorial also. They can get all the information together for us to attach to the legislation. Only thing is we need to know what the period, how many years we're going to approve this for. You know, we've been going 15, and then we did one for 20, so I don't know what our standard is right now. Chair?
Thank you. The main thing, I think, is there are some administrative matters that Navajo Department of Health has to basically do administratively, and that's the part that I think is one of the items that the bridge has to be crossed in getting this reauthorization. The other is I had emailed Ms. El Miligi that to look at the previous authorization and those requirements that they had to meet. I think one of them is the audit reports, as well as the certifications with the accrediting associations. Those are some things that are part of it. And once this tribal authorization is adopted, then they can actually sit down with the IHS to start their negotiations. Now, remember that authorization can go beyond the 3 years, but the particular 638 healthcare contract will be in 3-year increments. So, committee members, that's In receiving this report, then perhaps there'd be a directive to Dr. Jill Jim. We know she's very busy, but if she could designate a staff person who would basically get with Miss El Maligi to get all these documents together and proceed. The other is the annual report. I can't remember if you presented that annual report. It's been a while. Kind of disappeared behind the COVID pandemic cloud. So that part we would also need to review also as part of the requirements. With AILA committee members, if there's no other comments, then a motion and a second would be appropriate.
Hello, motion to accept the report to move forward with this Navajo healthcare.
Second, Delegate Paul Begay.
Sheila, Honorable Halona, motions, and Honorable Paul Begay seconds. With the understanding that Navajo Division of Health designate a staff person to help get this reauthorization package to the committee so that Halona can sponsor the legislation. What, Ayla? So, hey, Mr. Mose.
Yes, sir.
Roll call vote, please.
Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
One votes green.
Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika.
Green.
Honorable Edison J. Winika votes green. Honorable Charlene So. Chair, I vote of 4 in favor, 0 opposed.
Okay, let the record show 4 in favor, 0 opposed, and Honorable Charlene So still having technical difficulties, and the chair not voting. Thank you. There you have it, Ms. Bell Maligi.
Mr. Chair, for the record, I did text Dr. Jim and I did email her, but there was no response from her.
Okay, all right. So we'll get back to her with the request to name a staff person to help. That gives us to agenda item gets us past to go agenda item number 6, old business, there being none, and it brings us to item number 7, new business, A, scheduling oversight budget hearing. Ms. Martinez?
Good afternoon, committee members. Regarding the scheduling of oversight budget hearing, yesterday, August 11th, the BNF and OMB, Dominic Bial,
they moved the scheduling oversight budget hearing to the week of August 24 through August 28. They said they needed 4 additional days, OMB, Mr. Bial, because there's only 50% of the executive budgets that are in, and they need the whole, everyone's to submit theirs. So because of that, they moved it 4 days extra, Mr. Chair. So the oversight budget hearings will begin August 24 through the 28th. Maybe 2 or 3 a day if the committee can handle it. We can get done by Wednesday or Thursday. The only exhibits that we have at this time that are in is the Division of Human Resources, which has been forwarded to Office of Legislative Counsel. And Dodie is still working on those, theirs. And General Services is still working on theirs. I have not heard back from Veterans. Division of Social Services said they'll turn theirs in tomorrow. See, did I leave anybody else out? Anyway, we just got one in so far, and that's been forwarded already to Leg Council, Mr. Chair.
Okay, how about insurance services?
Insurance services is part of the budget and finance, and HES is just a courtesy that listens.
Okay. Retirement, Sean.
All same with retirement. They're just a courtesy to HES, but they're under BNF oversight.
Okay. General services.
They're still working on them. I just got an email from the accountant, Marlene Slim. She said she's still working on them. So I'm waiting for that one. I'm waiting for Dodie. I'm waiting for social services. I'm waiting for veterans. I think that's it. Oh, and then the only one that's in is human resources. Mr.
Okay.
Chair.
Thank you. Committee members. So our schedule has pretty much been set by OMB and BNF. We just have to abide by that schedule. What's Ayla?
Mr. Haven, did you want to put anything in about the registration status from OLFI or Kristen?
Miss Lowell, Mr. Haven.
Mr. Chair, Ron Haven here. I have proposed legislation for the HESI oversight divisions, departments, and they include human resources, health, general services, social services, veterans administration, and also Diné Education Dodie. So we are currently working on it. They should be out and they will be dropping on Thursday. They should be ready for pickup. So for Thursday, but I'm not sure about the budget exhibits. They certainly should be attached to the resolutions. So that's the status. Thank you very much.
Mr. Haven, I forward you human resources exhibits. And
yes, I got those. I got those. Okay. Those will be attached. Thank you.
Okay. And veterans, do they have a legislation?
I don't have the legislation yet. Not for veterans, but I'll get it later this afternoon.
Goshela, committee members, and just remember that the budget that we'll be hearing about is the general fund budget. I remember last year we didn't even look at all the other contracts and grants that each of these divisions that we have oversight over. We never even address those. And perhaps it might be one aspect that we include. I think one of them is Division of Social Services. The other, I think, is Department of Head Start. Oh gosh, let's see, where was it? We also had some concerns, but we can bring those up as we proceed. Committee members. I don't see us needing to have a motion or a second on this aspect. It's just, BNS's and OMB's basically said this is the way it is. Okay, what Ayla? Our schedule has been set. Anybody else? Not, we go to other, 7B, other. There are none. Then we proceed to item 8, close of meeting, announcements, and adjournment. Committee members, announcements. We had legislation requesting the New Mexico Public Education Department and the governor to not appeal the U.S. Department of Education impact aid ruling. June 8th, we had a meeting. Speaker Dimon, myself, and Honorable Carl Slater participated in that meeting, and all the 22 tribal nations and pueblos, they objected to the New Mexico PED filing the appeal. And after that, then the New Mexico Indian Affairs Department would be holding tribal consultation hearings. And I haven't heard back when those would be scheduled. So the matter of trust between the tribes and the governor was a big issue. And so in that regard, then that's how comes the tribal consultation is going to take place. And we understand that TIBIX is having their teleconferences. I don't know when the education portion would take place. Chase, Paul Begay, be sure and alert us so that we can be on that call with you, give you support on the TIBIX hearing.
Chair.
So, Che.
So today, as far as TIBIT, today it started at 12. We have land, water, and natural resources in discussion. 3:30 to 6 o'clock this afternoon will be budget subcommittee meeting. So tomorrow, Thursday, I guess it just says a full day of TIBIT meeting. The education was done on Monday.
Oh.
Those have been completed. Transportation education was Monday, public safety yesterday. Data management was done yesterday also. So I'm sure there are reports that might be available.
Okay. Sheila, the other announcement is we have Nabi tomorrow at 10 a.m. With Ayla, committee members.
Motion to adjourn.
Motion by
Second, Wanika.
Honorable Paul Begay, second by Honorable Edison Wanika. Roll call vote. Che Leonard, Mr. Mose.
All right, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
One votes green.
Honorable Pernell Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Wanika.
Green.
Honorable Edison J. Wanika votes green. Chair, a vote of 5 in favor, 0 opposed.
Thank you. And let the record show the chair did not vote. Committee members, we are adjourned. We'll listen to you at Nabi again, and then next week we have our regular meeting on currently on the 19th. With Ayla committee members, have a good day. Be safe. Do your social distance. Wear your mask. Go on that.